Good morning, everyone. Welcome you all to the fourth day of Bharat Nutrition Week, a 7-day long virtual initiative to support India's mission against malnutrition for building a Swasth and Ayushman Bharat. This is also to strengthen the spirit of World Nutrition Week, which is observed globally on the first week of September, and also India's very own Rashtriya Poshan Mah, which was instituted by the government of India to create a mass movement on Poshan Yukt Bharat. This initiative is also aimed at encouraging people for embracing healthy food habits as well as bring all stakeholders of health, food and economic growth to look into nutrition paradox that we face as a country in a more holistic manner. I am Kamal Narayan Omar, CEO of Integrated Health and Wellbeing Council, a social impact institution promoting health for all. Before we move ahead, let's have a glance on what ISW Council is doing and what is its mission. Can we have the AV, please?
Conclusion?
हेल्थ सर्विसेज कैसी होनी चाहिए ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है.
Exceptional contribution to health space has also been recognized through such initiatives. These forums also received an overwhelming response from the industry. Several legendary brands have come out to support these efforts and have become the real change agents. In its efforts to make health a priority, IHW Council is committed to the making of a healthier India. Global health hazard, economy and social uncertainties due to COVID-19 pandemic made us more firm and responsible in our ideology, and we immediately felt the need of taking our efforts to the masses through web and launched the landmark initiatives through our social media handles. Over the past 4 months, we have hosted many virtual summits, talk shows and symposiums, mega movements, and reached out to millions of audiences online through our extensive promotion on social media and digital space. IHW Council, always welcoming the like-minded companies, social organizations, and individuals engaged meaningfully in uplifting people, communities, and societies. Let's join the movement for people to get their basic birthright: clean air, clean water, good food and good health, and help in making Bharat a healthy nation.
The 7 days of Bharat Poshan Week are highlighting different critical aspects of nutritional challenges, their impact on health of our population, and ways to improve that. It also includes a unique Poshan quiz contest to engage and educate school kids on healthy food habits and nutritional wisdom. This is also in line with the idea mooted by the Prime Minister Sri Narendra Modi on his recent Mann Ki Baat. The virtual conclave also hosts daily good food talk show that brings nutrition experts and healthy food influencers to share useful tips, recipes, and to ensure right eating. Let's have a quick look on what has happened in the first 3 days of Bharat Nutrition Week. Frederick Douglass had said, "It is easier to build strong children than to repair broken men." The first and foremost thing that we can ensure for our children is good health.
Food is important, but beside availability of the food, we need to be aware of the what kind of food, how much food is to be taken. So these are the two important areas.
Nutrition today is a national will, or optimum nutrition is a national will. And when things trickle from central conviction and belief down the order, I think success is inevitable.
Marketers like us or marketers like others needs to be super responsible. What we are doing with the young generation, what we are doing with the kids, what we are doing with the moms.
So the food is there, but this food has to be made accessible in the family to those who need it most.
Family, home is the largest training institute in the world. All the adolescents, all the children pick up desirable food practices and food preferences at home.
So it's just about the jargon, about modernizing things so that it appeals to the younger generation.
So I'm so happy to see us all coming together for this Nutrition Week.
How can we safeguard our children from falling ill? The most important way to strengthen the immunity in your children.
All I'm saying is that give that child the ability to decide how much is too much, and give that child the ability to understand what is his intuitive eating power, and do not kind of force feed that child at each point in time.
It's important for information to be given to the child, because frankly, when you read information and you keep drilling it in a light, fun way to the child, some of it will stick to the child.
We have to discuss a balanced meal. My son, who's the older one, we regularly sit down and talk about like what are the proteins, what is the dairy. If I make a change to his meal plan or like reduce the milk and add something else, they know why these decisions are being made.
We welcome you all to India's biggest virtual quiz on nutrition, the Bharat Portion Premier Quiz.
Great. Round one. The theme for today is vitamin C and vitamin D. Let's start with our day 2 and round 1.
Coming to round 1.
So calcium warriors and fighters and immunity boosters are at 110.
All right.
Right. DC champions are at 100 and
Okay.
protein kings health crusaders are at 70.
Okay.
Can make very fun things with traditional ingredients but presented in a modern way that kids can like it. It was really wonderful and I really enjoyed the live session.
Today's theme is reducing, preventing non-communicable diseases. That is becoming a biggest challenge or one of the biggest challenge for our country. And to make us understand this critical aspect, we will have a host of finest experts from the country. And to host that first session, it's my great pleasure to invite Dr. Prakriti Poddar, who is going to moderate this a very important session, which has a lot of that knowledge and wisdom which we are going to see to how to deal with our growing burden of non-communicable diseases. Dr. Poddar is one of the most passionate ambassador of mental health, and she also believes that mental health is also getting impacted a lot with the kind of food we consume. And she has been consistently striving to spread awareness and sensitivity towards mental health. She is the managing trustee of the Poddar Foundation, which is dedicated to creating a better support system for mental health for all. So with this, welcome Dr. Prakriti Poddar, and then now the floor is over to you with our wonderful speakers for this session.
Thank you so much. Thank you so much for having me on this, and it's a real honor to be with all of the experts on this panel. I think this is such an important topic because India is on fast becoming the capital of NCDs, and I remember when I started the foundation, even though it was a mental health foundation, my first initiative was to curb obesity, and people didn't recognize that obesity was a mental health concern. In fact, when we look at, the entire thing was called OBCs, and it of course didn't take off as well as it should because nutrition was not taken seriously in mental health. But I'm glad that now, policymakers and opinion makers are looking at this as a serious conversation, and it's not just fad diets, but really understanding nutrition and holistic living from the way of eating right, because it is impacting, and clearly research has shown us that it's impacting cardiovascular disease, cancer, chronic respiratory disease, and diabetes, amongst a few, but of course there are many more. And I think let me start first by introducing who we have on the panel, and then we'll break it down into questions for each, and then we'll build on that. So we have with us Dr. Bhavna Sharma, who is the head nutrition science in the ITC Limited. She's also responsible for developing and implementing the scientific and nutritional strategy for the organization, and responsible for product development along with external scientific collaborations. What I loved most is that you are research based, and that's always so important because you've done research in vitamin D and the impact of it, the dietary intake, food consumption, etc., and also the focus on the children, because I think that one of the things that I would love you to highlight is how the nutrition in the first 1,000 days, how that really impacts the NCDs as we go forward. I think that is something that people don't really recognize. So that is going to be asked for you to highlight. Then we have Dr. Preetha with us, who is the Associate Professor of IIHMR in Delhi. And having done her MBBS from the Government Medical College at Trivandrum, the MD of the Community Health Administration and the National Institute of Health and Family Welfare in New Delhi. Your work has been rich and diverse across the public and private sector, which again, we know very clearly that we will ask you questions that highlight, what you think about how to really impact change going through the public and private sector. Her professional experience has been there for more than 14 years in the health sector, and the immense exposure in training, research, project program and management. So it's lovely to have you here. We also have with us Dr. Sachin Bajaj, who I have met before on another panel. Welcome again. And he's sort of been the alumnus of prestigious institutions like INSEAD, King's College in London, IIM, Calcutta, PGIMS in Rohtak. He's right now with the Ujala Cygnus Hospital as a director. He is a qualified medical scholar. After completing his MBBS from PGMIS, he did a doctorate in internal medicine from the Dr. SN Medical College in Jodhpur. Apart from this, of course, he's a certified professional. He's done a certified professional course on diabetes management and total control from the American Academy of Continuing Medical Education in the USA in 2008. So we're very happy to have you here, and looking forward to you sharing your ideas about what really one can do with the dietary controls that will aid our practice of good health. We have with us a columnist and author and a nutritionist as well, Dr. Ishi Khosla. Ms. Ishi Khosla is a practicing clinical nutritionist, which is really important because you're actually, touching the lives of people on an everyday basis. And what I love about your entire repertoire is that you're working with the obesity, diabetes, cardiovascular disease, food allergies, digestive problems, immune system, neuropsychiatric issues, and of course that's going to obviously make me smile, and the endocrine disorders in adults and children. And I would love, I know I might not even ask this question, but if you can rope this in when we're having the conversation about how a lot of the mental health illnesses are being tackled by just gut health. And I think that's something that's really important, and it's not part of our particular conversation right now. So we'll ask, of course, the questions that are relevant, but I'm sure you have the capacity to draw this in, considering you are a columnist and an author, so you have a way with words. We also have with us Dr. Nikhil Kelkar, the Joint Managing Director of Hexagon Nutrition. Nikhil is a graduate of Naya Hospital in Mumbai, a medical professional dedicated to clinical nutrition. He's responsible for the global clinical nutrition business of Hexagon Nutrition and is instrumental in establishing the Pentasure and Obesio brand of the company. He has worked for 7 years in New Zealand as a dental surgeon, and from the last 12 years, Nikhil is working as a senior management level at Hexagon. I'd like to welcome all of you. Thank you very much for being here. And we're going to definitely try to understand why India has to really make it a priority to eat right and to live right. So Moving on to the agenda, we know that people, even above the age of 55, as they start, the NCD burden has become magnified in our country. It's really time to opine on this, taking into account some of the research in terms of the dietary surveys that have been done, maybe household surveys. I'm not even sure what surveys get done on a policy level, and whether it's an NGO or whether it is the government. But we have some experts who can answer that, so we will move on into that. So Dr. Bhavna Sharma, my first question goes out to you. Non-communicable diseases continue to be an important public health problem in India, and is really responsible for a major proportion of the mortality and morbidity that's taking place currently. This, of course, is compounded by the change in the demographic, lifestyle, as well as just the habits and urbanization. I would love your input on what kind of research supports or, what kind of research highlights some of the burdens and what really compounds this issue, and maybe some of the ideas on how to address this issue.
Yeah, I think first, thanks a lot. I think what we are discussing today, and I think especially to the question that I've been asked, and I probably try my best to do this, because I think this question that you just posed is something that I think when I was a student, we used to think about it, and we used to think that, probably in the next 10 to 15 years, we are going to be able to manage it so well that we're going to be in a position that we're going to probably reverse a lot of damage that have been done probably in the last, 3-4 decades. Unfortunately, the situation has improved a bit, but it hasn't improved to the fact that we can say we are very good at it. What you rightly said at this point in time was that NCD, the non-communicable diseases, today, if you open it up and you'll see India is a capital for diabetes, India is a capital for this. I think for me, when I look at this whole piece, it comes together, in a bit of a side way. Today, where we are going as a country, where I think if I put the focus on, which is the most vulnerable group that we talk about, which is about the kids, I think one of the things that has always stayed with me is that this whole, the first 1,000 days journey, and how it is actually becomes like a ball that doesn't stop, and it starts becomes a vicious cycle and takes a big chunk of population along with it. And I think if I just have to put one number, because there is a huge amount of statistics that stays across, if I just have to take one number, I would say that, which stuck with me forever, and that has always been the inspiration for the research that I do, especially when it comes to children or pregnant women, which was also the topic that I kind of picked up during my doctorate, was about the fact that, India's stunting problem in the kids, it represents the largest loss of human potential in any country in the human history. This is something that I think the term that some of us will be familiar with is something we call as Indian enigma. So if I just to take that example ahead, I think probably 5 years back, we used to say that, we have 20 times more % of children under 5 who are underweight in India than how it actually should have been, given the resources, given the policies that we are working together. And in the same breath, 9 times % of children under 5 who are probably wasted in India as compared to what it should have been because of the predictions. And if you actually say that, almost all wasted children that we talk about in the world are actually living in probably Asia and Africa only. And half of all stunted children under 5, are actually again in Asia, and more than 1/3 in Africa. So what I'm saying is I don't want to throw data, but when it actually comes down to be, the truth is that today we are at a place, and I think we recently saw the NNMB data, which has also come, the UNICEF data, which has also come for kids, and adolescents. Those figures are quite heartbreaking. So when it comes to that, it actually says that we cannot shy away from the demographics that are sitting with us. If you see those numbers, where we actually have, kids, or pre-adolescents who are now who are actually diabetic and have high cholesterols. So that is a number that we all together need to work at. So, this is about the stats part of it. When you actually say about research or the kind of interventions or what are the kind of things that should be done or can be done, I think, like I said, this is not something that just an industry body or just the government or just, NGOs or independent experts can do. I think one thing that always comes together when we all actually sit down to discuss is that is a very, very complex, interconnected situation that we have here. It is not only about, and I think what our Prime Minister Modi just said, in his speech a few days back, is to say that even when it comes to food,
It's not only about the kind of food that we eat. It's about how much we eat, the frequency and the amounts of the consumption of the food, which has a direct bearing on the NCDs, which is impacting the country today. And it is also causing the economic loss, to the country today. So actually, when you see, I think all of us have a very unique and a distinct role to play into this thing. There has to be significant amount of statistics, significant amount of epidemiological data set that needs to be put in. And I think in a country like India, where we have our own unique challenges when it comes to gender, when it comes to kind of food availability, the food security, and like we said, accessibility and affordability plays a very big role. That number, that data has to be presented. I think somewhere down the line, we also realize that as a country, we are pretty much sometimes good at having data, but the application of data in order to convert it into policies, whether that policy comes about, including certain things into the midday meals or the Anganwadi support system that works onto that, or it actually goes to the fact of changing the policies on how food is handled, manufactured, processed, which is about the food waste of it, but also about which goes to the self-regulatory and the self-responsibility for the industry in order to come out and work in a responsible way when it communicates to the consumers eventually to talk about the good part of it and also take responsibility at the core of it to, not be part of the problem only, but actually also start to come on to solutions. And I think the real answer goes down to two words for me: honest research and credible policies. If these two things are taken care of, I think a lot of stuff can be handled very well together. That's my first thought, actually, on this.
Thank you so much. That's great. Honest research and what was the second point? Honest research and implementation.
And the policy implication, the policy implementations in the most sincere, where it matters the most, because I think there is no dearth. Like when I look back, I think 15 years back, I could have said that, I used to be part of forums where I would say, we don't have data, we don't probably know how to do it. Let's look at the other countries, how they are doing. Today, I'm telling, we have the data, we have the intent, we have the muscle. We just have to put these two things together, the honest research. And I think there is huge amount of sincere research which is happening in different pockets to bring it together under a theme, which is, I think, happening now as we see in the last few months and years, and convert it into application, either in terms of policies which go to industries in terms of communication, which is voluntary and sincere, and the other one goes to the, at the higher level, where even when we talk about imports or exports, whether we talk about ancient grains, midday meals and all the things. So research and policy. This bridge has to be connected, and I think
that's a very wide bridge, unfortunately. And I hope there are a lot more, there's a lot more done in this space, but that's important. Thank you very much. I'm going to move on to Dr. Preetha. Having worked across private and public sector, and we've heard about the bridge that we need to cross and navigate at this point, I think you can also highlight, going forward, how we can do that. I think one of the things that we're really talking about is this misalignment that we're beginning to see in the knowledge, but the lack of implementation and actually following through with even the knowledge that's being shared. I think even just in the videos that were playing before that, there was a lady talking about how you should allow your children to eat as much as they want intuitively, and they will know how much they need. And I think that on every table that I have ever sat on, I see a mother telling the child that the child doesn't know that they're full and they should eat some more. And then they complain about the child having put on weight and not being active enough. It's a double-edged sword. But not only talking about that, I think I definitely think policy is one thing, but change has to start in our own homes as well. But let's talk about the policy level and talk about how do we actually manage this disease burden caused by this dietary misalignment. Dr. Preetha.
Thank you so much. Let me thank you first. And as we all know, non-communicable diseases are so complex that the causes and the solutions do not lie just in the health sector. They are like spread across a number of disciplines. It's everywhere. So it is not just the health sector who has to work on it. All the departments, multiple departments, multiple sectors have to sort of come together. I've definitely worked in the private sector, but as of now, I think more like an academician. There's a lot of interest in the academic circles also about non-communicable diseases. You take the risk factors, nutritional transition, of course, along with the demographic transition as well as the epidemiological transition. It stands shoulder to shoulder with both of them in the causation of non-communicable diseases. And along with tobacco use or harmful use of alcohol, nutritional risk factors, improper eating habits, as a behavioral risk factor, along with a lack of physical activity, are major implicators for most of the non-communicable diseases. A lot of work needs to be done across sectors. I agree with the previous sector that there is a lot of data, definitely, but to convert the evidence into practice, we definitely need more information across sectors in different settings. We should think when we think about when we just take the nutritional dietary risk factors, to think that it starts at birth, even before, and I'm just parking it aside, to think that a baby who's breastfed, who is timely complementary fed, has a lower chance of obesity and lesser chance of having non-communicable diseases in life. There are so many other dietary risk factors. Have we done assessments? Have we done enough assessments? I really doubt. The latest WHO campaign is about eliminating trans fat from industrial settings. So there's a lot of work to do, for which the public and private sector can come together. The gamut of care is also so comprehensive that primordial prevention, the term diseases, the care that has to be provided to the population. The population needs are also so diverse that we have to take care of their promotive health needs, their preventive, primary prevention health needs. Curative aspect is also very important. There is always a tendency to sort of, undermine that part, clinicians. No, it's very important. The curative part is very important. The rehabilitative part is also important. So there's a lot of work which has to be done for us to enable evidence generation and to convert it into practice. As an academician, I teach, we have a lot of students, then we do research, we do training. So I think, in teaching also, it's a wonderful opportunity to sort of sensitize an entire generation of students about the importance of preventing, managing non-communicable diseases. There is a lot of scope for research, not just assessments, but also hand-holding systems to implement. In the sense that implementation research has a lot of scope. There's a lot of opportunity, and academicians are generally very interested to be part of that implementation research setting where we work together with the healthcare delivery system. Academicians would only, be on the sidelines, would just be monitoring, but the health providers themselves, so the members of the healthcare delivery system, would be implementing the solutions. So I again agree with the earlier speaker who said, it's not just about problems, it's also about solutions. So a lot of information has to be generated. Multiple sectors have to come together. Many departments have to come together. The social determinants of health, it's most important when we speak about non-communicable diseases. When we have these 4 risk factors and air pollution in Asia as the tobacco, lack of physical activity, nutritional factors, harmful use of alcohol, and air pollution. But we cannot forget the social determinants. And many experts say that these social determinants may be more important causative agents than the risk factors per se. So it is important that we have a very holistic approach. We involve multiple sectors, the different departments, and come together, do a comprehensive, have a comprehensive research plan, a teaching plan, inculcate into the curriculum, build healthy eating habits, right from very early childhood. So schools have an important role to play. The evidence can be shared with them, and it can be sort of built into the policies, and not in just health policy. This aspect has to come in all policies. Health is a very important priority, should be a very important priority. It should come into all policies. A lot of work can be done through research, training, teaching, advocacy, involving many sectors, and generate evidence and convert them into policy.
Thank you so much. I think you've touched on some really important points. I know at Podar Wellness, which is my company, we actually do preventive healthcare and not curative. And in that, our 5 verticals, the first vertical is mindset, and the second vertical is nutrition. So it's mindset, nutrition, physical fitness, recovery, and the last one is financial well-being. And when all these verticals are in place, you are in good health. And nutrition, like you're saying as well, and I think Bhavna has also said before this, that it starts at birth, and of course beyond that in the mother's sort of her nutrition during gestation. But the point is that it is the most important factor on how the brain develops, and yet we do not. We were thinking about it as a curative rather than a preventive, and I think that shift, if it actually comes in, we're all like holding on to a horse that's going to ride. Moving on to you, Ishi, you actually do practice a lot of the therapies as well, and help people in working with them on a day-to-day basis as well. So what are some of the in your area of work? What do you think are some of the challenges to actually habit changing, especially for people with diabetes? I know I live with somebody who has diabetes, and it's like we're policing the whole time, and I know that people want to change, but I think their taste buds override their intellect. I would love you to share your point of view on curbing the onset and not the onset, but the magnification of NCDs. You're on mute. Thank you.
First of all, thank you for having me. And some very important points have been made by the previous speakers. And really, I want you all to know that we really know a lot more than we ever did in terms of knowledge, in terms of the data, research. There is so much more today available to us as health practitioners and as people, as populations, like never before. Whether it's food, whether it's nutrition, and whether it's just basically information on how to live, we're far better informed. And even if it's kids, I think kids are better informed. The other aspect is about food. We are not short of food. So we have enough food, we have surplus food. Of course, there are issues regarding distribution, etc., etc. But what I'm trying to make an important point is here about the fact that there is still, despite the knowledge, despite the abundance, we are still battling non-communicable diseases and malnutrition at levels which we have no business to be. Whether it is iron deficiency, whether it is B12 deficiency, whether it's vitamin D deficiency. We are in a land of sunshine. We have no dearth of vitamin D, yet every other person or every person one checks is grossly, critically deficient in vitamin D. And despite iron, prevention of anemia programs, crores of rupees have been spent by the government, but yet anemia continues to remain at the same figure, whether it's children or whether it's women. So these are very important areas. And when it comes to regulation of eating, how much to eat, like you rightly said, we cannot be policing each other. We cannot be making food a war, a tussle of your willpower all the time. I want to eat this, but I can't eat it, or I should not be eating it. We cannot be living in guilt. Where has it all gone wrong? Were we supposed to eat like that? Do animals in the wild suffer from obesity? Chimpanzees, which are the closest to human beings in terms of their genetics, don't have cancer. And yet the pets that we keep in our homes, our dogs, our cats, they seem to be suffering from similar diseases as human beings, as the masters eat. Masters have, whether it's diabetes, obesity, arthritis, thyroid, all of these seemingly have crept into their lives. So something is needing to be looked at differently. Where we are going wrong. Why aren't we able to regulate our food? The pet who's constantly hungry, but the dog outside is not. There is a loss of regulation. There is, let me put it this way. We all have checks and balances. Even the baby who's born has innate checks and balances on when to stop eating. Or when the mother cannot force a drop of milk extra to a baby if the baby decides not to have. And I don't think that's disputable. We all know when to stop. But when we eat wrong, when there is inflammation of the system, our checks and balances begin to fall apart. And I see that in my practice all the time. So when in my practice, I deal with inflammation, I change the diet to an anti-inflammatory diet, I see absolute transformations. And this is real. And it's transformations not only in terms of how much the person is eating, but in terms of their numbers, whether it's a diabetic, whether it's heart disease, whether it is cholesterol, hypertension, or mental health, depression, or whether it's autoimmunity. Thyroid levels, they seem to normalize with the right diet. Diabetics who are on insulin seem to have, just within a few months, they're off insulin. And I'm not talking of one patient. It is every patient. And I don't know whether this forum is a right forum to talk about this, but yes, it's important to know that we are treating type 1 diabetics who are totally insulin dependent. That's the way they are treated. We are managing them free of insulin just by managing their diet. And these are real hardcore examples to support the fact that we are missing issues. We need to join the dots. And today we are in a position to do it. So yes, it's mental health, it's physical health, it's what you eat, how much you eat, when you eat, but it all need not be so complex. We've made it very complex. But if you go back to our ancient practitioners of health, whether it was Ayurveda or whether it is Hippocrates, they said all diseases begin in the gut. The ancient system of our Ayurveda says, Jaisa an vaisa man. They all seem to be so profound and so applicable to what we are seeing today. So if we are able to address these simple issues and we're able to accept them, recognize them, accept them, I think that's all that's needed to correct right from malnutrition to overnutrition. And having said that, I want to also make an important point here that even those who come to me as patients of obesity, who have abundance and are overeating, they suffer from critical levels of malnutrition, whether it's vitamin B12, iron, micronutrient malnutrition is rampant in the obese. So I think I'm going to leave it at this point that we need to join the dots. We need to understand that where are we missing the links, and that the two big issues that we need to address in our food system is inflammation and addiction. Why certain foods are addictive and how we can remove those foods, and how eating behavior can be modulated just by correcting these two issues. And I'm not oversimplifying these things. Of course, we need to do much more. We need to replenish the missing nutrients. We need to look at the gut health. And all of this, when I say all diseases begin in the gut, our gut is basically an organ in itself by the sheer number of microbiome, the gut flora. The importance of the gut flora today has been able to, explain so many things that we are suffering needlessly. How a disturbed gut flora, we call it dysbiosis. So all of this is, like I said, it can be so easily explained. And if we understand, literally, I would just end by saying, cure is in the cause. When we understand the cause, whether it is diabetes, whether it's heart disease, whether it's autoimmunity or cancer or malnutrition, the answers lie in just one single thing, which is treating your gut. So, and like I said, in clinical practice, one is theory. If a woman who comes to me with 20 years of an antidepressant gets off her medication in 2-3 months, and this is not one woman, there are so many men and women who I'm treating just by addressing these simple issues. And so it's really not that complex. And here they have been told by their treating physicians that these are lifelong issues and they'll have to be on medicine forever. So that's the power of food, and that's the power of how food can really transform our lives.
Amazing. Thank you so much for sharing that. I think it would be so important, and we have 2 doctors here as well who actually do run clinics, but it's so important for even our GPs to understand food. Because I know that, when I get people who we take in therapy, they'll be like, we went to the doc and the doc said, we told them we were stressed and they prescribed us some medicine. But I'm like, but did they ask what you're eating? And did they ask, how you're sleeping? And none of those questions were really asked. And I find it like just goes against general knowledge. I mean, how can you not ask what the diet's like? How can you not ask what's being put in? How many hours? Do they have a gap? What are they really doing? PMS. We know PMS is driven by the severity, is driven by the lack of nutrients in our body, and our body is unable to cope with it, and therefore, there is a huge mental health burden that comes along with that at that point. But there's so many things. So I'm glad that you're talking about it. I wish all the doctors could do a workshop on it, because they might be able to ask the relevant questions then. And I know Dr. Sachin Bajaj, you're here. Thank you so much for being here again. And I know that in your practice, you obviously talk about nutrition, considering you've educated yourself in this space as well. How do you make sure that the changes are being implemented, and how are we actually measuring the changes within the patients that we see?
Thank you very much, Dr. Prakriti, for having me here, and thank you very much, Kamalji and the entire team at IHW Council for organizing this very, very important conclave. I think in the midst of the pandemic, we've all forgotten how dangerous NCDs are and how much they are contributing to the global burden of disease. I would wholeheartedly concur with what Dr. Preeta, Dr. Bhavna, and Ishi said before me. Perhaps not to the extent of going that diabetes 1 can be treated completely with diet. I haven't had any experience around that yet. But yeah, most of the other things, I think I agree with everybody that most of the things that are affecting us right now are being contributed by the nutritional deficiencies and excesses that we are subjecting our bodies to. I come here wearing many hats. So I am a diabetes care physician mostly. Most of my practice is centered around diabetes and hypertension and chronic diseases. But I also wear the hat of a hospital a chain promoter. We run 13 hospitals in various small towns of North India, and we are finding the prevalence of NCDs increasing dramatically. Every village that we go to, we hold a lot of outreach camps. Just because of this reason, we've increased our outreach camps frequency to almost now 40 a week. Every village we go to, with every camp, we'll find at least out of the 100 or 200 patients we'll see in the village, at least 5 or 6 completely new diabetics who have no idea that they've been diabetic, and their level of detection on first intervention is anywhere like 300, 400, their blood sugar levels. And it's quite scary on how the NCDs are increasing even in villages. We think of these diseases as of being of the rich and of being of the bigger cities. I also wear a hat of a parent, and I have a son who was born. When he was born, he was quite sick. So, and he was the first a male child in a Punjabi family, as we know how they are pampered. And when he finally reached home after his prolonged stay in the hospital, everybody was hell bent upon feeding him, and it was like he was wearing the clothes of a 6-year-old child when he was 1 year old. And that is when I'm still very thankful to a pediatrician. So we were consulting our regular pediatrician, and he went on leave for two months to travel, and we met a new young pediatrician, and very thankful to her. She scolded us like anything. She was like, "What are you doing to your child?" And we forget that all these fat cells and adipose tissues are laid down in childhood, and then it's very difficult to reverse them. And that is why we have so much incidence of diabetes and obesity in the country, that we tend to pamper our children. And as Ishi said, the overeating and the oversupply of nutrition, it's just how different the distribution of food is. It's not like that the food is deficient, but the distribution is so different that it's very difficult to sustain all these issues. So thankfully, we had to put him on a diet when he was 1 year old, and then I started focusing on the nutritional issues of young children. And now, as part of our diabetic practice, we have a big education session just for infants and toddlers on how not to, feed them rather than how to feed them, is the issue that we focus on a lot for all the children of all patients who come to us. So it's a issue that is very prevalent. I think we need to focus much more, as you also said, on the dietary part of it. Every new patient who comes to our center, I think we have almost like 40 to 50 minutes just on his daily schedule, what they are eating, what they are doing, what they're exercising about, even before they see the first doctor. So that, I think, is missing in a lot of clinical practices, which I feel has to be focused upon. As Dr. Bhavna also said, we need a lot of policy issues, and I think the wide bridge between that has to, I think, somewhere at least we should start constructing it, if not aim for having the whole.
True. That is true. I mean, talking about parents, I have 3 kids, and I have one that's nice. He does everything correctly. And I have one who's just a nightmare. I mean, he will go for the junk cupboard the whole time. And of course, my husband says, "Why is there a junk cupboard?" But for me, it's not about like restricting, but about obviously educating them, giving them the sort of understanding, and then the odd treat here and there. But it's become difficult, and no matter how much I say, your fat cells are here to stay, buddy. If you carry on this way, that's what's going to happen. I'm helpless. So even though like we learned about this, and I've had doctors talk to him, I've taken him, scared him, like got the doctors to scare him. Luckily, he thinks he's fit, so it's difficult to get him to understand that it's not about how you're looking right now, but it's about what's happening inside, and it's going to start showing at some point. But as parents, I think we're fighting so many battles, just keeping them, happy, sane, normal, fit in all different denominations of their life, that it becomes really difficult. So I can imagine what the government is up to, because we're only talking about one kid here. They're talking about a nation. So it is difficult. And so I'm going to move on.
Every second kid in India is deficient in some micronutrients, and 40% have stunting. So it's the child nutrition, I think, is a huge challenge to overcome. Government is doing a lot of things, but I don't think that's enough. We have to really take it to the community level, especially in terms of girls. I think twice as many adolescent girls are anemic as adolescent boys. So there is a lot of issue around adolescents, children, especially in the girl child, and I think it needs to be taken care of on a world footing.
Yeah. So going into my next question, thank you for that, Doctor. So we have Dr. Nikhil Kelkar. Thank you for joining us from Hexagon Nutrition. And I see, because of you promoting desirable foods as well, and adding nutrients as well. I'd like to really understand from the health promotion perspective, what are some of the what is the roadmap that you have planned, and how are we actually going to sort of provide not only the education and the skills for good health, but going beyond that to habit formations?
So thank you very much, Prakriti, and thank you very much to ISW Council for inviting me. The question is broad, and I will try to answer, it more in terms of clinical nutrition, because I am from the field of clinical nutrition. So first of all, I want to wish everyone a happy Nutrition Month, or Poshan Ma, as we call it. And to understand clinical nutrition, we need to first understand what is medical nutrition therapy, or MNT. So the medical nutrition therapy is actually an adjuvant therapy to your medical treatment, and it is via the use of a specifically tailored diet, which is devised and monitored by a medical doctor or physician and or a registered dietitian. So clinical nutrition here in simple terms is a nutrition formulation which is designed to manage a disease or a health condition of a patient. And from my contribution to the roadmap, what you have asked me, this is one of the major aspects where we really need to create awareness amongst the general public. Because if you see, by and large, India's protein consumption survey of 2019 by the IMRB, it suggests that 73% of urban India is deficient in protein, and 93% are unaware about their daily protein consumption. And if we see our, regular Indian plate, which we eat, it's more based on the carbs and less on the proteins, and that is a major factor. And when we are talking about non-communicable diseases, that's what that over and excess of carbs later on it leads to things like non-alcoholic fatty liver disease and progressing to metabolic syndrome, diabetes, and that's what we are talking about today. So this protein deficiency is very, very important aspect which we need to see by and large at an all India level, and it leads to a commonly known condition called as sarcopenia, which is in simple terms is loss of muscle mass. And it's not just very common in the elderly, but it is also in the younger age groups, and due to the faulty dietary habits basically. So if we see a normal, individual daily protein requirement, it is approximately 1 gram per kilogram body weight per day. So that means if you take an example of a person weighing say 60 kilograms, so that person has to consume about 60 grams of protein per day, which is approximately equivalent to 10 eggs per day, just for an example. So this is what it is, and with the excess of carbs, it's really affecting. And this protein requirement really increases much more in a patient who's suffering from a medical condition, who is hospitalized due to a particular disease-specific condition. And as per the severity of the disease condition, for example, in cancer patients or in the ICU, this requirement of protein goes up to 1.2 to 2 kilogram gram per kilogram body weight per day. And then there is restriction of electrolytes like sodium, potassium, etc. If the person is a diabetic, the patient is a diabetic, simple sugars have to be avoided. So you need complex carbohydrates like maltodextrin or fructose as the source. And all in all, these specific nutrition requirements can be very well be catered by giving special nutrition formulas which are readily available, which can be easily reconstituted in water, and it can be given orally as well as if the patient is unable to eat, it can be given by tube feeding also. So whether it be it a diabetic formula for diabetes or a renal formula for renal patients or a hepatic formula for the liver patients, it is tailor made in such a way that the protein, carbs, and the micronutrients, whatever are required for that disease condition, it fits that. And this coronavirus pandemic has compelled us to rightly put health first, definitely, and we have realized much more that importance, and nutrition definitely plays an important role. And I feel that one of the best defenses against any such health risks like COVID-19 is to build a strong immunity, and which can happen through proper nutrition, because that's the first step. And obviously a protein-rich diet, which is very, very important. And as we have increasingly changing in this pandemic more to the snacking, more to the those kind of things which are high in fat and high in carbs. And I would also strongly recommend addition of soluble fiber to the diet on a daily basis, wherever it is available, wherever it is possible. And in the current situation of this pandemic, there is also a lot of demand for immuno-enhancing formulas, or the immunonutrition as we call it. So all in all, lots of things are available. We need more awareness about it. And I think, quality of life can be definitely be. So all in all, I mean, I would end by saying that, let food be thy medicine, and it is very much possible with the help of clinical nutrition. Thank you.
Thank you. Is that a very large field at this point? Yeah.
Yeah, it is. It is growing, and as I said, it's this that awareness. That these therapies are really available, and we definitely have very good qualified dietitians in the country who provide these services also. And yes, but the awareness needs to be created. That such kind of formulations are available in the market. That is missing in more of the general population, I would say.
Yes. If I can just now ask a couple of questions, you can decide who would like to answer. I think, Bhavna, this is more relevant to you, but you can decide, like I said, if anybody wants to take it up. When we're talking about these healthy food habits, I know, I mean, I'm in Vancouver, and I remember when I was in school here as well, we were compelled to actually read labels and discuss what those labels really meant on food. I know that in India, when we have our food, we do not actually have labels that are, like if I buy rice, I don't really have a label that's telling me how much sugar is in that either. If I buy, if I buy my dals, I don't know what protein, how much of percentage of protein I have in a portion. I'm thinking from a policy point of view, would it be essential then to have those things started up so that people can understand what they're taking in?
Yeah, so I'll take that up, Prakriti. I think what you just pointed out about the label part, I think that is pretty much the heart of what we're all talking about. Because end of the day, you can have only so many people who can write, be part of a policy making process, and even understand it for that matter. There are only so many people who are part of the actual innovation of a product development or industrializations and things like that. Label is something which goes to everyone, every single one, right? But there are two parts of it. So one is, what are the policies around the actual label today in India? And, so I am part of a certain, group, so I don't think I'm at the liberty of completely share it, but, we have progressed ahead. So if you see, with this whole percent DVs, which are part of, international labels everywhere, if you see, and there are different kind of labels which are now available, which are being either mandated or voluntary, if you see all across the globe. So whether they are the traffic light ones, whether they are the healthy symbol ones, whether they are the smart choices ones, there is some cue which is present on a label for people to make an informed decision and a choice for the things that they would like to buy. It would not only tell them about exactly what's present in it, it would tell them about the amounts of it. And I think a lot of responsible labels would also have the frequency of consumption indicated in one way or the other in terms of portion guidance or portion control, whether through a method of preparation, whether through a scooper, whether through a single packaging unit within a multi-pack and things like that. In India, I think the government has been very actively, along with the industry, along with the experts in the field, have been discussing this. And I think very soon, so there is already a draft that is available. And I think very soon, probably that should get implemented about, what would be the uniform way of sharing nutrition information on the labels and all the products, packaged products, I mean here. What would it actually have per 100 gram per serve? What is going to be the percent RDA, which is the recommended daily allowances for certain key nutrients? Everything is going to be there. I think there's also a discussion which is happening about maybe a more graphic or a pictorial representation of it, which helps people to understand whether it's, how they can make it part of their balanced, diversified diet. So that is one part. So I think that policy part of it is definitely in a very, very advanced stage right now, and it's probably going to happen very soon. There is another challenge altogether in India, which is about the whole awareness education part of it, which is probably something which is, I won't say that should become a limiting factor to the policy that is already happening, because this is one way or the other. But yes, I mean, I think there was a research that actually was conducted, a year back, which said that, do people actually read labels, even when it is present by some of the organizations who are doing it voluntarily. People actually do not read labels. They don't turn even back of pack. And I tell you, I'm living this day in and day out. So even if I have to put out a claim on pack, my entire marketing team would say, put it in the front. Nobody turns back of pack. We really want to put the information back of pack. Nobody does that, right? Today, if you see, there are QR codes, there are scanners, there are pictures you take and just put it in the app and it'll tell you every single thing. You go out and it's going to be there. Are people actually using it? Not so much. People get bored like this. It's so much information present that, there are less of people who can decode it for them rather than the information just present on the pack. So there is a whole part of, people doing it, industry and other bodies doing it responsibly. Policies around it, for the people who don't accept it or challenge it back or don't believe in it and things like that. The whole other part, which is, I think, probably the 50% if more, is that people able to understand it, absorb and adopt it. Because that is what the important part of it, that's the soul of it. Because, even if they do read, one is education, literacy thing. So hence in India, I think a graphic or a picture or a symbol probably is more helpful, in addition to just writing probably, or in place of writing. That's still getting debated probably. But I think in that segment, some bit of work has to happen in parallel about, when it is saying this is what it means, and I think fundamentally, food, when we talk about it, of course it plays a very critical part in nutrition, but it also plays a very important part in, that wholesome
joy, nourishing part of it. It's a softer aspect to it as well. So without losing that aspect and giving the information in the right way is something that is happening in India. And I think we are all wholeheartedly supporting that. We're working towards that. And I think a lot of us are probably part of one group or the other in a way. So that's happening. And I think that'd be good. And I think as we go ahead, the whole consumer education and engagement part, which has to happen again, like I said, with private and public initiatives together, is going to go a long way. Because that's going to help us, understand what am I eating, why am I eating, and how much am I eating. So that's the part of it.
Thank you so much. What I find fascinating is whenever we watch, whenever there's a celebration, there's a Cadbury chocolate, or whenever there's a celebration, there's a laddu, or something that's really unhealthy for you. I'm wondering if those kind of advertisements should be stopped at a policy level first. The government should just ban all this, because we promote unhealthy eating on every advert. Happiness, including our birthday parties, which are for kids, which means that you have to have a cake, you have to have those fries or like some unhealthy stuff, and you have to cater to this. So I mean, I think as a system, if we were to adopt changes in just this, I think like how you go to a movie and you see no smoking, smoking is dangerous. There's at least one text. When the laddu comes out, there should be another text that tells you this is really unhealthy and bad for you. Please do not indulge it, only for actors.
I think no, I think Prakriti, I understand emotion. I think just to put it just a little differently would be to say that, I think if you just tell people, like we always used to say that, have sweets during celebration and not every day as a part of a meal. That brings a lot of positive joy, that brings some spark to the festivities. I think the problem happens when you're eating laddu 3 times a day, maybe. So I think, like I said, I think we do recognize that, food brings us joy, but it has to be responsible, both in communication from the people who are manufacturing it and from a consumer perspective on consumption. So I think it's a balance. So I think that is why it is tough. But
so, Dr. Bhavna, I would like to push back on that. Telling people you can have sweets with refined sugar during celebration is just like telling them you can smoke twice a day and no more. I truly feel sugar is I would not advise anybody to have refined sugar at all ever. So, I mean, the impact is quite horrendous.
Ishi, you had something.
No, I think I just have a point of view on labels, and a very practical one here. That while Dr. Bhavna is mentioning the importance of reading labels, and I personally believe in the importance of having labels and breakup of nutrients, etc. But one question may be just directed to her, that how many times as a nutritionist do you read a label and eat your food? Or how many times are you counting your calories every time you look at food? It is even the best of professionals. These are great adjuncts, they're great tools, but we cannot expect public health problems to get sorted out just by this. Even till today, we have apps, we have so many tools and trackers telling us how much we are exercising, how much we are eating in terms of calories, etc. But food goes way beyond that. And if it's not translating into obesity management, it's not translating into better health, there is a question mark there. I think for public health and for consumers, the important thing is to talk to people in the language. They eat food, they don't eat nutrients. So let's communicate food to them. Let's talk about importance of having so many fruits a day, or having so many vegetables a day, or having a handful of nuts a day, or the kind of cereals or the amount of cereals they should be having, because that's what they connect with. Look at the plate and say, let your plate be half a plate full of just vegetables, maybe the rainbow colored vegetables, and the balance can be divided into the proteins and the other foods that they have. So food groups is what they should be talked to rather than nutrients. Nutrients is difficult for an average person to do on a daily basis unless you are sick or in a nursing care. We don't eat nutrients. I mean, really, food is way beyond nutrients, is what I believe. It's about phytonutrients. It's about so many other immunoboosting, which we don't calculate. We don't have them on the label. So, and I see these kind of things in my practice. There is a woman who's eating a bar, who's a diabetic, which is full loaded with the wrong kind of carbohydrate, because the bar says it's rich in vitamin C. And she says, I'm a diabetic and the doctor has told me vitamin C is very important. So this bar is great for me, because she connects. So oversimplification and giving this to information to consumers who are half educated, I would say they're not even aware of these aspects, can tilt the balance towards just reducing, I would say, making wrong choices. So, oh, this is fat free, or this is sugar free, or this is this free. And, they sell their products. So just nutrition information is not enough. I think consumer behavior can change only when you talk to consumers in the language they understand and the food they eat. That's the point I was making.
Can I add to that?
Yes.
Can I add?
I think just a second. I just, because Ishu, I think I completely agree with you, and I think that's exactly what I said. Just writing is probably 10% of it. You can only do as much as talking about it, because you also have to by the government policies. But like I said, being able to communicate, being able to tell, for them to understand, I think that's exactly what I said is the soul of it. Yes. People have to it's very important. It's very important to have it. Yes. Absolutely. And particularly when today you're talking about allergens. Allergies are going, they're out of the window. The rates at which food allergies are going up are really, so if people don't have that information on the label, it will be difficult for them to make choices. So don't get me wrong in saying that it's not important. It's very important, but I think to change human behavior or it's extremely important. Yes. I think it's just sequential.
I'm unfortunately going to have to close. I think the next session is almost ready, and we've overshot it by 9 minutes. But it was lovely speaking with all of you, and your opinions and your expertise was really profound, and I'm sure will really help people who are going to be watching this. I mean, from the food environment to behavior and behavior change to the food system. I think we've covered all the realms that we needed to cover, especially given the topic that we had. So thank you very much for being here. And with sort of ending this, hopefully you all are following healthy diets yourself, and because we often talk about it when we don't follow it. So I suppose we have to be what we actually say, and do that to ourselves. So thank you very much. And I think our next session is the moderator is going to be Dr. Gaurav Thakral. Please do stay on if you'd like. He's the Executive Vice President of Healthcare at Home. So do enjoy the next session as well. Thank you very much.
Thank you very much.
Bara, 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 ho bara. 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 12 से नीचे मुझे चैन ना आवे, दिल धक धक होवे, सांस भूल जावे. 12 से ऊपर हो तो जान में जान आवे, चेहरा खिल जावे, सारा काम हो जावे, फिर सब कुछ लगे प्यारा, जीवन जैसे बहती धारा, सबका मैं बनूं सहारा, क्योंकि मैं हूँ more than 12. 12, 12, 12 हो 12. 12, 12, 12 हो 12. 12 के नीचे मेरा दिल घबरावे, बाल झड़ जावे, चेहरा पीला पड़ जावे. 12 से ऊपर तो बात बन जावे, शक्ति आ जावे, सांस दुगना हो जावे. मिल गया खुशियों का इशारा, खुद को मैंने फिर संवारा, खुल गया सेहत का पिटारा, क्योंकि मैं हूँ more than 12. 12, 12, 12, 12, 12, 12, 12 हो मेरा हारा. 12, 12, 12 हो 12.
Even I am more than 12, which means that the iron content in my blood is more than 12. If it's less than 12, then we are anemic. And being anemic is a hazard for every woman, for her health and for her pregnancy. Let's make India anemia free and take the first step today by taking a blood test. The iron in your blood has to be more than 12.
Welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A, R, T, advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. Artist has also laid emphasis on lending emergency care and medical aid to women during childbirth. Artist has closely worked with the national body FOGSI and international body FIGO. The skill transfer by Artist is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
Hi, good afternoon, everyone. Welcome to the 4th day of Bharat Nutrition Week. And in this session, we are going to discuss some of the ignored aspects of nutrition, specifically for working professionals, more so women and the elderly. And of course, some chronic disease management like diabetes, thyroid, and cancer patients also. So while I was thinking about this program, it struck to me in our childhood, there was this DD advertisement in which they showed that a lady at home would be the last one to eat and she would have whatever is the leftover. So that used to be a very, very harsh reality which the DD was promoting, no women health, healthy mother, healthy lady, healthy family. And I see that over the years, it has been, I think, over 3 decades, I don't think that the formats have changed. Still, our most corporate working women, and Subhashri would agree with me, somehow that is still happening and women tend to ignore their own health. Well, I think despite a lot of progress, women still give themselves the last priority, and that's why this discussion becomes very important. Well, some facts. The latest National Family Health Survey 4 reports indicates that 50% of all women between the age of 15 and 49 years are anemic in our country. In urban areas, 54% of women suffer from anemia. Micronutrient deficiency is the most common problem among these women. And they lack in one or more essential micronutrients, leading to several mental and physical health problems. The most common being low calcium levels, vitamin D levels, which are most commonly seen in working women. Sadly, it is not the undernutrition. We are now a progressive country, and hence the problem is not only undernutrition, but obesity and overweight also. And the survey says that 20% of women are overweight or obese, and the figure is 31% in urban and 15% in rural areas, which was a surprise for me also, that rural India is also getting into overnutrition, which is also malnutrition. Having said that, I think the women, when they're juggling between various responsibilities, apparently do not spend enough time on exercise, leading to slower metabolism and poor absorption of nutrients. Ironically, despite the current flow of fitness, mobile apps, Fitbits, gyms around us, there has not been a proportionate increase in the numbers, especially when it comes to women who exercise. Even traditional practices like yoga that are receiving a lot of attention and hype are not being practiced by majority of women. So that's the situation where we are. Coming to the second part of our discussion, which is the elderly and the chronic disease management. So WHO says that between 2015 and 2050, the elderly population is going to double from 12% to 24%. Malnutrition is a major concern. The incidence of malnutrition ranges from 12% to 50% amongst hospitalized elderly and 23 to 60% amongst institutional older adults. And also, elderly tend to restrict their diets. In the garb of Satvik Bhojan, they omit lot of nutrients. To add to this, almost 80% of older adults have at least one chronic health condition and 50% at least two. Most costly chronic health conditions include heart disease, strokes, cancers, and diabetes. And food insecurity or lack of access to appropriate foods may lead to nutritional issues. And that is what the pertinent issues we are going to discuss with our star-studded panel today. So to introduce the panel today, which is going to address the needs of working women, cancer patients, chronic disease management, elderly, we have with us our most revered Dr. Rajesh Bhalla, Medical Advisor, Indian Cancer Society, an alumnus of Armed Forces Medical College, Pune. Dr. Rajesh Bhalla is a postgraduate MSc in Defense Studies, MD Hospital Administration, and even a DNP in Healthcare Administration. Dr. Bhalla started his career with the illustrious career in Indian Navy since 1972 and has a diverse experience in private healthcare where he has worked with the hospitals like ELK, Fortis, Max, Dharamshila Cancer Hospitals, and also with academic institutes like Indian Institute of IHMR and the likes in Delhi. I welcome Dr. Rajesh Bhalla, sir.
Thank you.
I also have with me Subhashri, Group Corporate Dietitian, Reliance India Limited. Subhashri Ray is a corporate dietitian with Reliance Industries Limited, which is the now I think the largest conglomerate in India, and a PhD scholar of ketogenic diet with 8 years of experience in nutrition science and medical nutrition therapy. She is a public speaker of nutrition, health, wellness, and lifestyle management, has authored 17 scientific research articles in various national and international journals. She has also presented her research work in 17 conferences, workshops, seminars, is an advisor for many organizations and companies dealing in food and nutrition, a reviewer and editorial board member for reputed international and national journals, and lifetime member of several reputed nutrition bodies in India. I welcome you, Subhashri.
Thank you.
Very interesting personality today we have is Sahil Pruthi, founder Keto India, somebody who was made for the Silicon Valley and engineer by background, has taken integrative oncology and nutrition as his passion. Sahil Pruthi, the founder of Keto India, is an engineering graduate from Netaji Subhash Institute of Technology. Prior to Keto India, he was working on building and scaling healthcare tech startups in Silicon Valley and one of the India's largest growing travel marketplaces. Realizing the power of metabolizing fats as completely different source of fuel for the body and to break the myth that the fats are bad, Sahil started Keto India with a team of nutritionists to help people not just lose weight, but various other health backgrounds, specifically cancer patients. I welcome you, Sahil.
Thank you so much. Thank you so much. So happy to be a part of this panel.
Great. And we also have with us our youngest panelist today, Amrita Sandhu. She's the director and co-founder at Care India Health Private Limited, working towards offering individuals good quality, affordable, primary and preventive medical services under one roof in small Indian cities. Her key focus is towards improving women's wellness as well as helping diabetic patients manage their disease efficiency. They place a strong emphasis on wellness and nutrition as the backbone to good health and say that the diet can prevent various chronic disorders. I welcome you, Amrita.
Hi, thank you, everybody. Nice to be here.
So let's start with the women health and Subhashri here. So Subhashri, you're working with a lot of workplace intervention programs where you're looking after protocolized nutrition in women health. My first question to you would be that what are the challenges you see in working women, and what are the various special needs you see that we need to cater to working women and working professionals?
Right. So good morning, everyone. Rather, good afternoon. So, like you said, that um, women always put themselves in the end. I mean, they're always people. So I have also always seen that. So when my colleagues come to me and say that, I have to take care of my husband and I have to take care of my children and I don't get time for myself. So that is the most common line what I hear from my women colleague, that I'm not having time for myself. And if I say that, okay, you are a pre-diabetic, and if you are taking care of your diet today and you are doing physical activity, and if you are, practicing meditation, so you can correct that situation. But what they say that I don't have time. So, this is a very, very common line that I keep on hearing from them. But that doesn't make any difference in their nutritional status. So most importantly, what I am observing is vitamin D deficiency, and there is a severe, lack in anemia and vitamin B12. I mean, a lack of iron and vitamin B12 in our women population. Also, in organization, I mean, we are also seeing people like women who are also obese, and young women specifically, like, who are of my age, maybe 25 to 35, this age group, they are becoming overweight and they know everything. So the pattern, what I have seen in working women is that they're more cautious than men. Let me tell you that. So I faced a lot of challenge to make a man, like my male colleague, understand that why he should be practicing a good diet and a lifestyle. When it comes to women, they know it all because they keep on searching, they keep on browsing, they read it, and they have groups, WhatsApp groups, so they share it. But when it comes to implementation, it's always they have to think, they think about themselves last. So deficiency is a very, very big issue. So like across India, the prevalence is there and we are no different. And also I see lack of protein in them because so there are a lot of PCOD cases. So if we are talking about non-communicable and communicable, so there are a lot of deficiencies which are there, and also PCOD is very common in our, in general, what I see in the population. So these are the major issues. Yeah.
Great. And what are the various workplace intervention programs, or the whole lack of right? So, for example, I'll give you an example. In our organization, what we did was that we started involving the family itself to take care of that woman. So I had this typical case where, again, the hemoglobin was low, LDL was borderline, and this was a middle-aged lady, again, with low calcium levels and low vitamin D levels. And we spoke to the husband and son, right, that as important as you are for this lady, the lady is equally important for the household. And then they started monitoring the eating habits and the supplements and everything, and that really helped. So what are the various simple things which Reliance Industries, or you being their corporate dietitian, is putting into place to overcome these obstacles?
So I think, in the organization, we are putting a lot of effort in number one. So we do a lot of, awareness session. So every month we have target-based intervention where we take group of women and we speak to them. And also we have our database where we know that who is a deficient person, who is having pre-diabetes. So we have all categories. And every month we have a monthly theme based program. So every month there is a theme, and we keep on organized program basis that, and there is always a special lecture or a special discussion, like we are doing panel discussion, a special live session for the women employees, particularly for them. This is number one. Second, what we are doing, so in canteen I have made substantial changes. So that's not only for the women, because in RCP, in my corporate office, and in our entire group also, in across India and manufacturing, if you see, we have huge canteens and food courts where we prepare all sort of food. So we don't have any, scarcity or any lack of variety. So we get butter paneer, we get salads. So what I did, I added a lot of healthy recipes in those menu. I have added so majorly breakfast menus, which are very important. Like I started dalia upma, to just like make sure that they are eating it properly. We also started varieties of bean salad so that they can come. And so when we address the women employees, we say that these are the particular food or menu which is available in your premise, which will give you required amount of iron and calcium so that they don't have to go anywhere. So I always recommend that in the evening, in the evening. So rather than having a vada pav or a samosa, you can just go and try this chaat, this salad, what we have, started. And I'm very happy to say that women in general stick to that. So if I'm asking them, so they better comply with it rather than men. Again, I'm very sorry, I might sound biased, but it's very difficult to, change their perspective. So these are the intervention what we have done. Also, there are monthly, like 6 monthly checkup of bone density levels. So we have periodic medical examination and basis the result. We take personal intervention. So now that I am there, so I prepare all customized diet plan for all the women, and I have follow up with them. So it's very structured right now. And also the family, what you said, so family counseling we also do. We address the family, particularly when there are an occasion. Other than that, if we see that some lady is saying that it's absolutely not possible for me, so yes, I also spoke personally to some people. We didn't do it from organization level, but yes, personal level, because it's in my hand. So I keep on speaking to people. So I tell them that, okay, this is something what she needs to do, and she is having very severe deficiency of calcium and vitamin D, which will cause damage to her bone health, and you need to take care of her diet, and these are the food list what she has to have. So these are the intervention what we are trying to do. And in manufacturing division level, we have lot of intervention, because there are townships. So the entire population is inside the township. So you can always call the families and can talk to them, which is difficult for our offices because we don't have families staying here. In manufacturing division, it's really good. Even I visit, like before COVID, I used to travel 4 times a month so as to go to geolocation, manufacturing division. So we have to go from corporate, right? So there, around 6:30, 7, even I demonstrated few healthy recipes to the family. So our medical officer over there and the team, so they arranged for that, and we did the demonstration. So it's very nice to be doing these things. It's easy in manufacturing division because we have a structure there, but in office people come, do their work, and they go out, right? So yes, so all these things we are currently doing.
I'm really impressed. It's not that easy as you're speaking it, right? I have worked with industries like Jindal Steel and Power Limited, and so it is very, very difficult to implement and monitor and do a trend setting of that the health parameters are improving. I must congratulate you on the good work you're doing. And from here, let me go to Dr. Rajesh Bhalla sir. Dr. Bhalla sir, you are working with the Indian Cancer Society, where you have a battery of these cancer fighters, right? Which you train, which you reinforce, and they somehow meet the special needs of these cancer patients who literally have very, very specific needs on not even nutrition, but I would say counseling, hand holding, and a holistic care. So could you throw some light on that part, the special needs of the cancer patients, and specifically the role of NGOs in that?
Thank you, Gaurav. You see, Indian Cancer Society, or in short we call it as ICS, we've got 60 cancer survivors. I prefer using the word fighters rather than survivors. Now, most of them are ladies, and we also have about 15 children with us who are also attending school but are getting the treatment done also. Now, coming back to these ladies, they're all volunteers. They are all volunteers with us, and having gone through a process of having cancer within their body, and being treated thereafter, surviving and going for regular checkups. They are highly motivated ladies, 60 of them, and they go around most of the hospitals in the NCR. They've been given specific areas, and they go across over there and help out the newly detected patients, precancerous or cancerous. And that helps them out in those hospitals as to where to go, whom to meet, how to get investigated, and thereafter, of course, the treatment part of it. Now, these volunteers also guide them, because the topic today is basically on dietary regimes. So they also guide these patients on the dietary regime depending on the type of the cancer which has been detected, and also the organ involved. Because whether it's the breast, the lungs, the cervix, the ovaries, the pancreas, liver, colorectal, head and neck, etc., there's a slight variation in the type of food which each person is supposed to have. It's not that one size fits all. No, it's not that. And no two people are alike. Maybe a lady with ovarian cancer, another one also identical ovarian cancer, even if they're twins. Even then, the diet regime is a little different. Here, another element comes in very, very strongly, and that's temperament. Something which we always miss out. But every person has to be looked into separately. And then these volunteer ladies, they educate these individuals on food products, antioxidants, intake of nutrition and adequate diet, quantum of the food to be eaten, intake rather, preserve the body mass, protein intake, who's to take protein, how much and its quantity, fats, vitamins and minerals, and its food components. Most importantly, which we miss out, is the fluid intake. Fluid intake, especially in cases of radiation therapy and chemotherapy. That is where otherwise the sickness sets in. Now there are certain items like turmeric and cinnamon, which of course our lady over here, Subhashri, will be able to guide more on. Now these volunteers are specifically trained by specialists. Specialists like Ishi Khosla, who is very much attached to our Indian Cancer Society and doing social work with us, and also Subhashri. They train them, they educate them, and they have regular classes, including reorientation classes at least 3 to 4 times in a year, so that they do not give incorrect or misguide the cancer patients, which is very, very important, because what happens today in the media, social media, people keep on saying a whole pile of things which may not necessarily be correct. I personally guide whoever asks me. I said, look, you want to go to some sites? Go to WHO, the World Health Organization site. Go to ICMR in India. Or you go to the CDC, that is the Center of Diseases in Atlanta. These are the sites which give you actual and factual information, because otherwise they will not be released by that particular organization. In addition, awareness on good hygiene practices, especially in case of patients who are undergoing chemotherapy and radiotherapy, and even after that, because some organs do get partially destroyed after going through this therapy. In addition, if they have comorbid condition, that also has to be tackled. For example, a person may be having diabetes, type 2 diabetes, and what particular type of food elements to be taken. For example, sugar. Should the person have white sugar, jaggery, or anything else? All this is part of it, which they are guided. Then comes the age-related balanced diet. Again, one size does not fit all. Whatever a person, say, of the age of 30 having cancer, another person at the age of 80, they will not have the same balanced diet. It will have to be customized to their requirement. So these volunteers learn all this and then pass them across. Last but not the least, there are two elements. One is the caregiver and one is the patient. Morale boosting, something which we always forget. So these volunteers they participate in that. They go and boost up the morale of the patient and the caregivers. Very often the caregivers are relatives. The relatives will obviously be conveying that information, what has been told to them by their parents and grandparents and their uncles and aunts. Now that sometimes has to be neutralized so that the morale of the individual stays high. Any cancer patient should have the will to fight it out. That's why I call them as cancer fighters. Thank you. I think I'll go to the next.
Thank you, sir. That was really, really very insightful. And I must again congratulate you and the Indian Cancer Society for making these fighters give that personalized physical touch to the people who are really lost when they get cancer. But what I am seeing now is a change from physical touch to phygital touch. And that's where COVID has taught us in healthcare at home India, home care was always taken as a nurse at home. That was the most essential factor, right? But with now technology playing a very big role, telemedicine playing a very big role, app-based management taking a role, we are managing thousands of patients on home isolation, which are COVID positive but are mildly symptomatic or asymptomatic, right? And that's where the world is moving from that physical, these volunteers which I used to see in whether Rajiv Gandhi Cancer Institute or in Dharamshila Cancer Institute, right? I've seen that movement happening in the last 1 quarter or so. So coming to our engineer turned nutritionist, Sahil. So Sahil, you are using a methodology which is one, keto diet, which many people want to talk about. And secondly, this chronic disease management thing on chronic patients through these phygital method. So tell us more about yourself, your Keto India and the integrative approach, please.
Sure. So first of all, thank you so much for having me on this panel. And secondly, I'd probably want to give you an idea about one, what we do, and second, what are the problems in the current healthcare system that we are trying to solve in the company as well, right? And we've been able to help people in India and across the globe better manage their chronic issues, right? And these chronic issues can range from type 2 diabetes to hypothyroid to PCOS to oncology as well, right? First of all, you want to understand what chronic care issue is, right? Anything that lasts for a longer duration is a chronic issue, and anything that is for a very short duration is an acute issue, right? So issues like these are typically catered to using standard of care, right? Which is, for instance, a PCOS patient would typically be told to take either a contraceptive pill or take a metformin to be able to reverse their symptoms of their PCOS, which could be irregular period cycles, facial hair, acne, a louder voice. All of those symptoms are typically just told to be taken medications like these, right? And they're typically given very ambiguous advice in terms of the fact that they're told to lose weight, right? And that's a very ambiguous advice to give, right? Similar is the case in type 2 diabetes, where you would often see doctors tell you to take a drug like metformin, and that will be asked to reverse their type 2 diabetes. And similar is the case in something which Dr. Bhalla talked about, was malignancies or cancer care management, where the chances of a relapse are extremely high. Right, so these are all major issues that typically happen in chronic care management, and the standard of care clearly is not sufficient to be able to completely reverse or manage or make the management of chronic care issues sustainable, right? And that is a problem that we're trying to solve here at Keto India, where we talk about the fact that one, weight loss is not plain calories in and calories out, which means that it's not a physics problem where you reduce the calories and you end up losing weight. It is actually, and chronic care issues will not be a one-size-fits-all, which is what Dr. Bhalla talked about, right? So one radiotherapy and only chemotherapy will not be a one-size-fits-all to solve for a chronic care issues, right? And so what we're trying to basically solve is through integrative methodologies that can help you reverse or manage their chronic care issues at a more sustainable level, right? And in most cases, allopathy might not be the most sustainable. It can be one of the parts, but different layers that can personalize and sustain your protocols, which could be naturopathy or nutrition, or integration of clinical trials in the standard of care. This forms a holistic, integrative method of solving chronic care, and that is what we're trying to do at Keto India. Ketogenic diet is one of the therapies that we use here at Keto India, but we also use naturopathic supplements and different kind of nutrition protocols that are personalized for an individual, right? So it is not that the diet, the person has to fit in the diet, but the diet has to fit in the person's lifestyle, and that's very important. That's what we try to do, right? In the process, as I said, that reversing chronic care issues is not a calories in and calories out. It's actually a hormonal issue. And what we try to do is that we try to lower the insulin resistance through nutrition that can help you completely reverse your type 2 diabetes, right? So people who we've consulted so far, they have seen a reduction of almost or over 1.1 in HbA1c in almost 3 months only, which is very difficult to achieve using a drug like metformin, which is what women take a lot given their lifestyle, right? The second thing is, again, in PCOS, drugs like metformin are trying to lower the insulin resistance, but they're not efficient enough, and you cannot take them lifelong, right? So a protocol like a ketogenic diet or a low glycemic index diet, a low glycemic index means foods that do not spike up your insulin too much, are extremely efficient in reducing your symptoms of your PCOS completely. And just to put in some context, that 1 in every 10 women in India have PCOS, right? And that is not just attributed, and that cannot be attributed to just your hormones, but also your busy lifestyle, the amount of stress that we have, which is the cortisol levels, and all these are major contributors to actually having PCOS in the first place, right? So just to put some context and give some direction to women watching this, if you have PCOS, don't just have a gynecologist on your panel who can be advising you, but also have a nutritionist who can help you out in your lifestyle changes that can make things more scalable for you, and PCOS is reversible, right? Similar is the case with type 2 diabetes. Just to add to a couple of points which Dr. Bhalla raised in terms of malignancy or cancer care management, again, the standard of care, which is radiation plus chemotherapy, that typically targets the malignant cells in the body. But again, it is not targeting the underlying issues why malignancy happened in the first place, right? So malignancy happens because of a mistake by the white blood cells, because it could not recognize the malignant cell to be destroyed in the first place, right? And it continues to repeat that mistake over and over again. The second reason is underlying inflammation in the body, and that is what, and insulin resistance. So these are actual core issues which can be catered to through nutrition, which could mean taking anti-inflammatories in a diet for somebody who already has been diagnosed. And anti-inflammatories could include turmeric, is what can be a preventive measure. But if you want to use turmeric as a more curative measure, you have to use curcumin, which is the core element, right? But sadly enough, curcumin is only 2 to 5% in turmeric, right? And that is where a lot of naturopaths go wrong in, right? So the problem is that CDC has actually declared that curcumin is so little that cannot result in apoptosis, for example, in malignancies, right? So you have to take the curcumin extract and combine it with black pepper for maximum bioavailability in the body that can help you manage your malignancies, for example, right? There are hundreds of examples like these, which can be integrative oncologies, which can complement your standard of care. You don't have to say no to what your doctors are saying, but you can add these and they can help you increase the efficacy of the standard of care, right? So chronic care issues can be managed and reversed through the power of nutrition, and naturopathy is what we solve here at Keto India.
Wow, it's mesmerizing to hear an engineer talk so much medicine, right? And I think that was a lot of value adds, especially talking on integrative. I must appreciate, Sahil, your every word you speak oozes your passion for what you're doing, and I wish you all the best for that. Let's move on to Amrita, who was very, very vigorously nodding to whatever Sahil was saying. And so motto with Amrita is that disease prevention can be done through diet, right? So
yeah, so a lot of what Sahil was saying is exactly my belief at Care India. So I have actually opened a wellness pharmacy by the name of Care India, and we are really focusing, it's a wellness pharmacy, so we sell all your health foods, your vitamins and your supplements, and we are really educating the importance of correct nutrition with the belief that it can better manage and reverse and prevent diseases. So exactly what Sahil is talking about, whether it's PCOS, hormonal imbalance, these are 1 in 10 women do suffer from these problems, and a lot of all these lifestyle diseases like diabetes and heart disease, a lot of them can be reversed with correct nutrition, regardless of the medicine that your doctor is prescribing you. So, I'm not going to go into we all know the alarming stats of India, of how it's the diabetes capital of the world. 70% of our 70% of our country, people do have a lifestyle disease, and 20% of the kids are obese. So these are the statistics out there. And I just feel that now, in this time of Corona, people have become more aware about what they're putting into their body. People are more concerned because obviously it is a disease that does have more consequences for people suffering from lifestyle diseases. And I think that is what's getting, I think people now being at home, we should focus on foods that can help us improve our health as well as boosting our immunity. And so, I mean, just a few pointers. I'm not looking at like a specific disease category. I just generally, if we look at people, let's say, I feel that we should all look back to how our ancestors used to eat. So whether it's something as basic as our roti, you know, including things like bajra, ragi, amaranth, having more wholesome, high fiber ingredients in our roti. That's one. The second is, even if we just look at things like ketchup and sauces, for instance, this is things that people have with their sandwich. They have have ketchup, samosa, they have a ketchup. A lot of these sauces have so many added sugars, which people need to really take note of. You know, even if we're using soy sauce when we're making an Asian stir fry of vegetables, it has such a high salt intake. So it's not actually the foods that we are eating that are bad. It is the additional things that we're putting into these foods that I feel that people really need to take note of. That's one. The second is, if we just look at the Indian diet, predominantly it's roti, sabzi and dal. Right? So I feel that people should really focus on, are they getting the right levels of protein versus carbohydrates and sabzi? You know, a lot of the times I feel that we're having more carbohydrates in our foods than protein. So this lack of protein leads to a lot of problems as well. So just like simple swaps, like, you know, chia seeds. So a glass of chia seeds can give you about 4 grams of protein. Or let's say spirulina, 1 teaspoon of spirulina has again 4.5 grams of your daily intake of protein. So or even like if you replace rice with quinoa. So I often have dal and quinoa. So again, 1 cup of quinoa has 8 grams of protein. So, I mean, my advice to people out there is that why don't you just eat the regular foods that you're eating, and that day note down, okay, how many grams of protein have I consumed, and how far off or close are you to your daily requirement? And I think just doing that test for one day will kind of give you an idea about the type of foods you eat. So you can assess yourself that, okay, am I getting the right levels of protein that my body requires? So these are just a couple of pointers, even in the types of snacks that we have. Again, like Subhashri said, that, you know, that she's including a lot of bean salads. So I feel that we should really focus on having good snacks. So like, you know, maybe having hummus for a snack with cucumbers and carrots, or increasing our intake of nuts and seeds, like, you know, having pumpkin seeds in our salads, flax seeds. These are all things that are, again, high in fiber, good fats, and also keep you full for longer, the high satiety value foods. So I think people should really focus on how we can include these good foods into our diet, which have more nutritional value. I'd say like the foods that we eat should have more nutritional value. And then going back to so at Care India, we really focus on disease prevention through diet, you know, so whether it's diabetes, obviously 35% of our pharmacy patients are diabetic. So we have a whole section in our pharmacy for diabetic health and diabetic foods. So we're telling people that, okay, if these are, you know, if you're having diabetes medicine, these are also the foods that you can eat, because obviously the things that you put inside your body is eventually what's going to solve your disease. So a lot of people who have you know, joined our nutritional program and seen a lot of success results with just improving, like incorporating small things into their diet. Like let's take apple cider vinegar, for example. You know, there are so many health benefits that can have. So at Care India, we are not just selling you medicine. We are kind of telling you that, okay, yes, you have to have the medicine because you have this disease, but these are the foods that you can eat. And we have a nutritionist in our pharmacy as well who can help you, you know, improve your lifestyle. And going back to again what Subhashri said, how women put themselves last. We like, I personally believe that a woman controls the home. You know, whether she's looking after her husband or her kids, she is the one who is running the kitchen. So if as a mother, you know, you are eating the right foods, you are automatically passing on those habits to your children. You're the one, you like, what you eat is what your kids eat. So if you are changing the foods that are being eaten in your kitchen, then your family is automatically going to be healthier. So I feel that women should not put themselves last. They should actually really be those role models and actually assess what we're using in the kitchen. Like, you know, whether it's the type of oil you're using, you know, how much oil is being used. Are you using desi ghee or coconut oil, olive oil? You know, some oils are really bad for you. Like, actually understanding the types of oil. Like, are you having the right good amount of good quality of salt, like pink salt or sea salt? So I just think women should, as mothers, go and see the basic ingredients that are being put into their kitchen, and, you know, use these ingredients more, and like get rid of the things that are not needed, like all these sauces that are filled with sugars, you know. So I think if we're looking at overall nutrition, I think Corona has taught us that it is the most important thing. People who are healthy from the inside, they are the ones who, you know, are going to be better able to fight off a virus such as Corona. And yeah, we should really look at the foods that we're having, superfoods. You know, there's so many, whether it's spirulina, wheatgrass, moringa, there are a lot of these foods have so many antioxidants in them. And a lot of people often don't know how to incorporate these foods. And that is why at Care India Pharmacy, we have a dietitian and a nutritionist on board, so that she can then help our patients who are buying medicines on how they can also improve their daily diet.
Thank you, Amrita. That was really great. I think a lot of simple tips to follow. Let me go back to Subhashri. Subhashri, so another thing I think which we face in a woman's life is menopause, right? That's something women has to deal, and there also again holistic care, psychological support, and nutritional support play a big role. So, how are you guiding people at your workplace during this phase?
Okay, so, you know, menopause is not just about diet, and like you said, that it's a total process where a woman goes through, you know, a lot of psychological changes, hormonal changes. They tend to gain weight and they don't know how to lose it. Sorry. So there, my, you know, first of all, I always try to calm them. So though I'm a nutritionist, but I'm a very, very big advocate of mental health, because I believe that if a person doesn't have a sound mental health, he or she is not have a problem like motivation. You lack a motivation. You are depressed. You are sad. So it's very difficult for a person to, you know, continue with a goal. So first I try to talk them through, because this is a phase where they have a lot of changes in the body, so they don't know how to manage it. There are sometimes they say that I'm very much heated, I don't know what to eat, and I stopped eating, and so everything like she eats, she feels that, okay, this is creating harm to them. This is number one. So that's what I try to first soothe them, that, okay, this is fine. This is just a procedure and we will get through this. Second thing, what we are trying to do is that we have two groups of women, what we do intervention separately. So we have program for women who are up to 40, and we have program separately for women who are above 40. So there we address these issues. I try to give a general idea that what menopause is and what are the changes like she can expect, because that is important. If you are prepared, then you are manageable. I mean, you can manage it better. After that, I encourage them. So in that group, what we do, we have a yoga specialist with us. We have a meditation specialist with us. So there's one doctor, a colleague of mine, who is specialized in meditation. So he particularly work in that issue, that to calm the mind down. And then number two is nutrition, what I take up, where I speak about importance of a holistic nutrition, like Amrita said. I mean, I am working in COVID since so long. from the beginning as a public health specialist also. So what we are seeing, that I totally agree with her, that nutrition is the root cause. So if you see the association, everything is nutrition. If you are malnourished, you are more vulnerable to contracting the virus because you have lack of immunity. Malnutrition, I'm talking about undernutrition and deficiencies. If you are overnourished, that is, you are obese and obesity-induced disorders like diabetes, hypertension, so then again, you are prone to more severity and mortality. So it's all come back to the root cause, that is nutrition, what you eat, how you live, what is your lifestyle. So that is the main mantra all the time for post menopausal women also. So what I try to do is, I give them the idea of holistic nutrition. I don't believe in a particular food, Gaurav. I mean, I don't think that there is one food that can help you. I'm always someone who wants to, who believes in totality, because you need to have everything. So I teach them what is a balanced diet and what is the importance of calcium. How do they include calcium in their diet? By taking yogurt, curd, and simple buttermilk every day, the importance of iron, and particularly taking care of the part that they might, accumulate a lot of adipose tissues when the estrogen starts, that doesn't secrete anymore. So these are the issues. So specifically bone health and the obesity management, what I do for menopausal women. So that is the intervention.
Great. So in the last 10 minutes of this discussion, let me jump back to Sahil. Sahil, keto diet, as many understand, is a fat-rich diet, right? एक तरफ हमारे बुजुर्ग ये कहते थे कि fat नहीं लेना है. This is what we have been taught, low-fat diet, right? And then come proponents like you who say, oh, fat has to be the most important part of your diet. Take as much fat as you can, right? Can you debunk some myths on keto diet and some advantages of the keto diet?
Right. That's actually a very good question. And I'll give you an idea about what are the myths that I hear every day as we work with people, right? The first is that fats will actually raise your cholesterol and triglyceride levels, right? That's the first thing that you will hear a lot, right? But on a ketogenic diet, what you're actually doing is you're eating the fat and you're burning all the fat in the process to produce ketones, which is ketone bodies from the body, right? From your dietary fat and your body fat, right? So while you're eating that fat, you're actually burning fat, and you'll actually see a significant reduction in your triglycerides immediately. You might see a slight increase in your cholesterol, but eventually you'll see a reduction in your cholesterol levels also, right? That's the first myth that we hear a lot. The second is that, and the second add-on part to it is that the amount of dietary fat that we take is very insignificant to the amount of cholesterol that our body produces by itself. So a fun fact is that our body produces 3,200 milligrams of cholesterol every day. And to be able to match up that amount of cholesterol, we'll have to eat 40 whole eggs to be able to match up that kind of cholesterol, right? So counterintuitive as it may sound, that if you take less dietary cholesterol, your body will end up producing more cholesterol, right? That's the second myth that we hear a lot, right? And the third is that people talk a lot about saturated fat and LDL, right? LDL actually is often called as the bad cholesterol, and HDL is called as the good cholesterol, right? But if you go a little more deep in terms of the science of it, HDL is high density lipoprotein and LDL is low density lipoprotein. So it's not cholesterol itself. These are carriers of cholesterol, and they are lipoproteins, right? And they become bad when LDL becomes bad only if it is inflamed. And inflammation happens when you actually combine your trans fats or bad fats with refined carbohydrates, right? Which is simple carbohydrates or simple sugars as we call them, right? So if you combine the bad fats with your simple sugars, that is what actually results in LDL being bad. Otherwise, LDL is not as bad as people talk about it, right? American dietary guidelines actually removed the limitation of fat from, it was initially about 15%, 18% of the dietary guidelines. But the dietary guidelines have removed the limitation of the amount of fat that you can have on the diet, right? So fats are not as bad. You need the fat to actually to cater for different parts of the body, functions of the body. And most importantly, people also talk about fats will make you fat. That's the most common myth that we hear a lot. So I'll give some detailed science and some basic science that everybody is able to understand as well. people talk about fats having 9 kilocalories per gram. That would mean that because they will go in caloric surplus and they will end up gaining all the weight, right? But coming back, that weight loss is not a calories in and calories out. Like, you don't have to subtract calories. The more dietary fat that you take, there is a hormone in the body called as leptin, right? And it sends signals to the brain that I am full, right? And dietary fats cater to leptin the most, and they give signals to the brain that I am full. And that will not happen if you take too many carbohydrates, which is what Amrita also talked about, right? That if you take too many, if you take a lot of good amount of fat in the diet, you will not feel hungry for longer, which will make you feel satiated, right? And if you've taken dietary fat, you will by default be in a caloric deficit, contrary to popular opinion that because it has 9 calories per gram, you'll end up, you cannot have 900 calories of butter every day, right? Because it will make you feel so full that you will end up being in a caloric deficit by yourself, right? So things like placing your diet with sufficient amount of good fat, healthy fats, and right source of protein, and having complex carbohydrates or low glycemic index carbohydrates is the right way to go. Even if you cannot do a ketogenic diet, which can be a little hard for some people, you should adopt to foods that can be low on the glycemic index, that do not spike up your insulin. That means that complex carbohydrates like whole wheat, quinoa, I would probably prefer taking almond flour or a coconut flour for your diet, right? These will not spike up your insulin. They will make you feel satiated for longer. If you're a non-vegetarian, you should have the right kind of fat sources, which could be chicken, fish for your omega-3s. If you can eat fat, have the right kind of coconut oil. Ghee, desi ghee is extremely healthy. I could go on and on about the benefits of it. And the right kind of protein sources for vegetarians could be paneer or soy. Or whey protein or pea protein for vegans, right? So people who are pro-veganism, they can also take pea protein, right? So if you combine that and the right kind of fat sources, you will actually not gain weight, and you'll actually curb a lot of chronic care issues that you might have, right? So that's the right kind of myths that we hear a lot. And most importantly, I would probably add to one of the points that Amrita raised really well, which was sauces. While we were in the initial stage of the company, I kind of realized that the moment we go out, everything in a packet is something that is most likely unhealthy, because to be able to store that in a packet, they either put unhealthy source of fat, which are not good for our body, or they will put sugar, which triggers a portion of the brain which is called as dopamine. So you keep going back to that packet over and over again, right? So if you want to have healthy food in the diet, have something at home and avoid anything that is coming out from a packet. It's the simplest hack to avoid any sorts of chronic illnesses on the long term.
Great, Sahil. I think that was quite interesting hack, although all the kids are going to hate you by saying that don't have sauces and don't have chips and all that stuff. I'll go to Dr. Bhalla sir. Dr. Bhalla sir, any closing remarks before we close this session?
You see, what everyone has mentioned today is absolutely fabulous. There's no doubt about it. The only thing is, how do we convey this to the masses? Now, that is very important. You see, what we are doing in a little small group over here. Now, this is where awareness comes in. And I am sitting at a place called Cancer Detection Center at Babur Road in Delhi. And anyone who comes to us for a checkup, not necessarily a patient, I call them as individuals. And when they come over there and if I'm examining them, I think I spend half my time educating them on certain awareness programs, like what we're discussing today. And some of them said, Dr. Sahab, hum iske liye thodi aaye hain, hum apna jaanch karwane aaye hain. So I tell them, I said, I agree with you, but until you understand why this problem has taken place, now you tell me what your problem is. Believe you me, half of them, especially ladies, they say, aapne maar ko already jawab de diya. You know what happens? This awareness thing is where we are lacking. And that is very, very important. And it should be genuine awareness. So we have leaflets and pamphlets we give out, and we tell them, it's free of cost, don't bother about it. Read it and come back. You know, a surprise, college girls, college ladies, they would come back and ask questions. You know, like vaccination, HPV vaccination, things to that effect. How do you prevent cancer, cervical cancer? I just spell out a few snippets, and that's how they come back. And their nutrition also plays a role. And last but not the least, what I call as the mental health. Among the NCDs, mental health takes a last position, but is equally important. Thank you. Nice session.
Sir, thank you. I think this was a very, very interesting session. We had all the wisdom from Senior Dr. Balla sir, all the technical expertise from Subhashri, and two young entrepreneurs who talked of so many new things, which was a great learning for me too. I must thank IHW Council for organizing this panel discussion, and I think, as sir said, more and more awareness would lead to more and more balanced diet and less disease and less comorbidities. Thank you so much, everyone, for contributing to this panel discussion. And we'll be back for the next session after a short break. Thank you so much, everyone.
Thank you so much for having us.
And welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A, R, T, advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. Artist has also laid emphasis on lending emergency care and medical aid to women during childbirth. Artist has closely worked with the national body FOGSI and international body FIGO. The skill transfer by Artist is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
The world moves on buttons and clicks. Smart lights adore our homes. Digital locks guard our information. And green tea is our healthy brewery. We forget how the tea bags emanate waste, polluting the environment. Bid adieu to your regular tea bags and leaves. Refresh your tea mood out of the zing with the new in thing. Introducing Shilpa's Green Tea Films. Smart brews for the ready-to-use green tea fast-dissolving films eliminate food-grade plastics altogether. Refresh, recharge and rejuvenate with the world's only ready-to-use green tea films today. For more info, visit www.shilpaotc.com.
bara, 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 ho bara. 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 12 से नीचे मुझे चैन ना आवे, दिल धक धक होवे, सांस फूल जावे। 12 से ऊपर हो तो जान में जान आवे, चेहरा खिल जावे, सारा काम हो जावे। फिर सब कुछ लगे प्यारा, जीवन जैसे बहती धारा, सबका मैं बनूं सहारा, क्योंकि मैं हूँ मोर देन 12। 12, 12, 12 हो 12। 12, 12, 12 हो 12। 12 के नीचे मेरा दिल घबरावे, बाल झड़ जावे, चेहरा पीला पड़ जावे। 12 से ऊपर तो बात बन जावे, शक्ति आ जावे, सांस दुगना हो जावे। मिल गया खुशियों का इशारा, खुद को मैंने फिर संवारा, खुल गया सेहत का पिटारा, क्योंकि मैं हूँ मोर देन 12। 12, 12, 12, 12, 12, 12, 12, 12 हो मेरा 12, 12, 12 हो 12।
Even I am more than 12, which means that the iron content in my blood is more than 12. If it's less than 12, then we are anemic. And being anemic is a hazard for every woman, for her health and for her pregnancy. Let's make India anemia free and take the first step today by taking a blood test. The iron in your blood has to be more than 12.
conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है.
Exceptional contribution to health space has also been recognized through such initiatives. These forums also received an overwhelming response from the industry. Several legendary brands have come out to support these efforts and have become the real change agents. In its efforts to make health a priority, IHW Council is committed to the making of a healthier India. Global health hazard, economy and social uncertainties due to COVID-19 pandemic made us more firm and responsible in our ideology. And we immediately felt the need of taking our efforts to the masses through web and launched the landmark initiatives through our social media handles. Over the past 4 months, we have hosted many virtual summits, talk shows and symposiums, mega movements and reached out to millions of audiences online through our extensive promotion on social media and digital space. IHW Council, always welcoming the like-minded companies, social organizations and individuals engaged meaningfully in uplifting people, communities and societies. Let's join the movement for people to get their basic birthright: clean air, clean water, good food and good health, and help in making Bharat a healthy nation.
Thanks, Gaurav. Nutrition is the key to address most of India's health problems. ISW Council's Bharat Nutrition Week between 1st and 7th of September is a sign of our commitment for making a healthy India. This is another landmark initiative to bring all stakeholders together to bolster the efforts of making a portion-yukta Bharat for all. Now, Indian cuisine is known the world over for its vibrant flavors, delectable spices, and fresh herbs. But how does it go when it comes to the nutrition quotient? According to a research by the Indian Market Research Bureau, the protein deficiency in Indians is more than 80%. 73% of rich urban population is protein deficient, and 93% of them are unaware about the daily requirements of protein based on their body weight. But proteins are the building blocks of cells in our body. Many people think they are unaware because they think that only those who do bodybuilding need proteins, but actually proteins are needed in every cell of our body. Wherever there is wear and tear, whenever repair is involved, we need proteins. And we are seeing that 71% of Indians have poor muscle health as well, and that is directly related to the fact that proteins are lacking. So milk, eggs, chicken, and pulses are the well-known sources of proteins. But if you check the inflation data in India for the last few years, you will see that the maximum price rise when it comes to food categories is in the protein-rich category. So our topic of discussion today is pocket-friendly nutrition. Vegan and non-vegetarian nutrition fight. To talk about this, I have with me very knowledgeable set of nutrition and well-being experts. Please welcome Garima Bhandari, yoga and wellness and image coach. She's an internationally acclaimed yoga expert, and she recently served on the panel of experts for the Ministry of Ayush in the first ever Digital Yoga Conclave 2020. We also have with us Nidhi Mohan Kamal, nutritionist, Director, NIDSAN Wellness, and she's a food scientist with a food and chemical engineering degree and a specialization in nutrition and sports-specific nutrition. We also have with us Seema Jindal Jajodia, owner, Nourish Organics. Seema Jindal is the founder and MD of Nourish Organics, India's leading clean label functional food company. Welcome to this talk, ladies. We're very happy to have you with us, and what we want to discuss is, of course, how nutrition can be reached for Indians, which is pocket friendly. So let me start with Nidhi. I'll come to you first. Do you think that micronutrient malnutrition and especially protein deficiency is a big issue in our country?
Well, this is an issue in the country, and I mean, obviously, a number of studies have already suggested that there is a deficient in terms of protein. But as you rightly said, that a primarily meat-based diet is what is looked at as nutrition. But I'm sure Seema would add to it that there are a lot of native Indian foods which are very protein-rich, but I think they're not marketed very well. So they're not considered, and they were a very integral part of our diet earlier on when we did not have any Western influence, but now we kind of mixed up. So we have picked up things either from the West, partially from our past. But if we eat according to what our climate is or what is native to us, I think we can find a lot of protein sources which are cheaper, easily available, local, seasonal, and very, very good for your health. I'm sure Seema will add a lot.
We will come back to the list of proteins that meet those criteria. But Seema, Nidhi is saying that we've gone away from what was traditionally our diet, from traditionally what we used to grow. Now, how much of that is responsible to the because of the way the government also caters to food security in our country? You will stockpile rice, you will stockpile wheat in the country. People who used to have bajra, ragi, they are now eating more of rice and wheat because that is the way our food security is built. Stock up rice, stock up wheat, and that's our diet. That's mainly carbohydrates. So, it isn't just about for people like us who have many choices. Yes, we don't even know about our traditional, millets and other foods. For those who used to know, feel that, चावल and गेहूं for 5 रुपए and 10 रुपए जो सरकार से मिल रहा है वो ले लेते हैं. They don't realize the impact it has on the nutrition.
So, hi Anisha and hi Nidhi. Nice to see you again, Nidhi. And I know that Nidhi knows about Nourish Organics, and I hope Anisha you do too. So, you're absolutely right. When India was, trying to get that, reach the mission of having that nobody should remain hungry. Then the easiest things to grow were the staples, which became wheat and rice. And that is a literally industrialization of farming per se, where put in as much fertilizer, let's put in as much, let's grow the fertilizer industry, let's grow the pesticide industry. And the end result was that our native wheat, which used to be very rich in protein, actually became, totally GMO and genetically modified, and it doesn't have the same properties as, now some of the vendors have kapli wheat, some special varieties of wheat, the indigenous Indian wheats. More than that, convenience foods and the westernization of our culture. So to say we want to look a little more Western or American, by eating burgers and pizzas and pastas and cakes, I remember growing up, cakes, my mom used to make cake only if there was a birthday in the house. But now every second day, we can just walk into any mall, any place and pick up a, cake and eat it. And what we don't realize is that we are filling ourselves with empty nutrition, empty calories. And so we're missing out on nutrition. And where, if we still go to some of the parts in the hills, especially, where their indigenous food is all the different millets. Yeah. So they are not eating all this maida and all this. They are eating samak, they are eating ragi, they are eating madua, they are eating all these amaranth. They are eating this as like a normal thing. Like we will think that, oh, today I'm having madua ki roti, I'm like a
and it's exotic. We see that as exotic.
But in the hills, and a lot of areas in the south also, they are treated very normal, and that's what they eat because they realize the benefits of that. Some of the things which are very reasonable and very high in protein is our matar, dry matar. It's called safed matar, peela matar, and very typical dishes are made. In Calcutta it's called ghugni, in Delhi it's called matra, and these are all things which are very popular and made in a lot of households. It's a very easy thing to prepare. It takes in a lot of water, and so it's actually a very easily digestible protein. And the way it's cooked with a lot of ginger and things like that, it gives it the right digestive enzymes as well. So I really, today I thought the battle, or sort of the fight was between vegetarian and non-vegetarian. But I think the battle for all of us is that how to get the indigenous foods and the rightful place of them in our kitchens, in our diets, in our diets.
Okay.
And, yeah.
Talking about cakes, Seema, ever since the lockdown, people are just trying baking and, cakes, not even on a weekend. It's like cakes every 3 days because people are so bored sitting at home that they feel that, baking skills should be worked on. Now, I'm going to take that vegetarian versus non-vegetarian battle to Garima. Garima, I wanted to understand from you, the belief is that the Indian diet is largely a plant-based diet, and that is one of the main reasons why we are protein deficient. Now, in Ayurveda also, plant-based diet is recommended for a healthy body. So what do? Healthy body, plants, less protein. How do you manage? Garima, sorry, you are muted. Can you unmute yourself?
Sorry, apologies. Thank you, Anisha, and thank you everyone who's present here with me. Yes, very rightly said that, there's this always huge dilemma between vegan, vegetarian, and somebody says I'm a pure vegetarian. Somebody says that, I'm going plant-based. But there's always, some sort of a discrepancy when it comes to, will I be able to suffice for all the nutrient deficit if I switch from non-vegetarian to being a vegetarian and all that. But it's a misnomer, because vegetarian and vegan diet is completely full of all that we need. And I, being a Pahadi, as Seema was saying, I've eaten my ghee, my madwa, my ragi from my bachpan, so for us dessert would mean madwe ke laddu, madwe ki roti with homemade ghee. So I still follow that till date, and thankfully my kids have developed a taste for it. And I think all these naturally grown millets and grains work wonders for your overall body functions, brain functions, robust, what do we say, robust overall development of your entire body in terms of strength, stamina, anything that you need. So for me, as you were pointing about the Ayurveda part, I would definitely like to quote here that Ayurveda also says that you are not what you eat, but you are what you digest. So it's very, very important to also keep that in mind, that eating right is definitely important, but also moving your body to be able to digest it and having a robust metabolism is also equally important.
Right, but where do you stand, Garima, on this vegetarian versus non-vegetarian diet? Because now even the government has a milk plan to increase dairy farming. We in India have the biggest milk output in the whole world. We're the biggest producers of milk, and because there is a protein deficiency, the government also says more dairy farming, more milk and milk products. So is that the way to go forward? Animal sources of protein?
See, I feel that to each their own, because almost 16% of our body weight's composition is protein. So it's an indispensable part of our existence, and we definitely need dairy to suffice. But these days, like I see a lot of people being lactose intolerant. So there are definitely other ways to suffice for that kind of a deficit. But dairy is an essential part of a person, and I think it's imperative to have dairy if you're not, intolerant to dairy.
So right. Sorry, are we allowed to butt in?
Yes, please,
yes,
go
please
ahead.
do. So my thing about dairy is, the antibiotics and the medicines, the hormone medicines which are given to the cows, to continue lactating, is what's really scary to me. Because we don't know at what level it's going inside our body and creating harmful effects,
Yes, definitely. There is a concern about even, antibiotic resistance, which comes in because of, the antibiotics that are given to cows, to chickens, and then we finally consume them. And that is also another health problem. But really, I want to understand whether I can get all the proteins I need by just following a vegetarian diet. Nidhi, could you help us there? Because, it is a belief that lentils, dals are good source of proteins. Other than that, I don't know of many vegetarian sources. Soybean is also supposed to be a good source of protein. Are these readily available in our country? If you are vegetarian by choice, is it a given that you will be protein deficient, or can you actually get good sources of proteins?
Okay, so just to elaborate a little bit, I'm vegan for the last 4 years, so no dairy, no meat, no animal products. I second what Seema said, that now dairy is being pushed as an industry. Now there are two things. One is it required as a nutrition? And secondly, do you need it as an industry? Now, just forget everything else for a minute. Forget that milk is an industry and it's a commodity. Just think of it as one animal species and another. One animal species produces a sufficient lactate their kids because they cannot eat anything else. And then another species comes in and says, I need your lactating solution for me to survive. Technically, it didn't make sense to me. The reasoning I give everyone else, why do you need milk? Milk is a growth hormone and food for the calf. The calf is grow 250 kg. And
sorry, we are not. It's not. Anisha, am I the only one?
Even I'm having a problem listening to Nidhi. I think we'll go back to Nidhi again once the connection is more stable. But Seema, you spoke about pesticides and how antibiotics enter the food cycle when it is not intentioned for this. But organic food, which is a good alternative, which is the thing to do, is viewed as an expensive alternative and hence only reserved for a few select people in our country. What is the way out? How can we have organic food which is more affordable?
I think it's very important to remove this, that organic is expensive sort of a label, because, it doesn't have to always be certified organic. If people start eating local and seasonal, then you don't have to eat organic. So it's really important to see what is growing in this season. If it's like mangoes season is now over, but we will continue getting some mangoes because they'll come from the cold storage. It will be a little more treated and so on and so forth. But now the apples are in season, so if we keep on switching to what is seasonal, then not having any treated and, too much chemicals into our product. So it's okay to not have organic, but at least have local and seasonal.
Yes, but say in Delhi, we get a lot of our fruits and vegetables which is grown on the banks of the Yamuna. Okay, now the banks of the Yamuna are not proper agriculture land. Plus, the Yamuna carries all industrial effluents you could think of. So, I mean, if I'm going to eat local, I am going to get a lot of products which are not good. In fact, it's documented that there is, there's a big problem of worms because the kind of soil that they are growing the crops in is not very conducive. And I mean, these worms find their way into the vegetables, into you, and then wreck your body. But if I have to, in a big city like Delhi, if I have to go and, buy only local, then these are my options. I can understand in Bangalore, there are a lot of organic farms close to the city.
Anisha, in Delhi also, we have a lot of farmers now who are growing nearby. And it's really important to get to know your farmer. And, this COVID time has really given us a lot of opportunity to actually see what we are eating. I have personally growing vegetables on my little terrace for a long time, and I have tori, and I have petha, and I have karela growing right now. More than that, every Sunday when the farmers markets used to happen, in Malcha Marg or City Fort, or there are so many farmers markets that happen now. So I have built my connection with some of the farmers. So even though the markets were not happening, I would talk to them कि भैया क्या हो रहा है आपके यहाँ आजकल, अच्छा हम आपको ये भिजवा देते हैं. So there are options. So where there is a will, there is a way. And
but we need some awareness because I live a stone's throw away from City Fort. I didn't know there's a farmers market.
The organic farmers market at City Fort is fantastic, and there's a really nice one at Sundar Nursery. And they are a delight to go to because, if somebody is growing something, they sell it like their own baby, it's like they sell it with so much passion. And when you buy that food which is grown with so much love, you also get a lot of benefits, besides the nutrition from that food. So get to know your farmer. I think, the the more we can inculcate the habits of growing even little bit vegetables, whatever we can, on our terraces, in our balconies, get our children involved, use the spare plot which is lying next to your house, grow something there, let the community have it. During the pandemic, I shared my seeds. I had some extra seeds. So I gave it to a lot of the people in the colony, and every time somebody's Karela comes out, they are sending me a message that, my plant has this, and it's such a great community feeling. I think these are things that, as you said, the Yamuna sand is not nice, and there are growing cases of the worms and other things. All these are indications that we need to move inward. We need to take things in our own hands. We need to do, we need to add some love in our balconies, in our terraces, and start to grow things and get to know where our food is actually coming from.
Yeah, that's a good idea. And we have Nidhi back with us.
If it's growing in Yamuna, I would go and meet the farmer there. भैया कैसे देते हो, ये कैसा पानी है, आपके बच्चे खाते हैं क्या ये, chances are that he's not giving that food to his children, so it's good, it's a good idea to go
get to know who you buy your food from. Nidhi is back with us. Nidhi, Seema was emphasizing on the fact that you don't have to buy certified organic food to get good nutrition. But you were talking to us about good sources of proteins, because there is, everyone knows there is a protein deficiency in our country. It is attributed to the fact that we are largely plant eaters. So what's the way out? Even if we want to be plant eaters going ahead, will we have to live with the protein deficiency?
No, we don't. It's again, correct me if I'm wrong. Commercially, it's not viable for anyone to prove the good points of plant-based, where you can, because the billion-dollar industry, the supplement industry. So unless you prove something is required, how are you going to create a need for it? If we are the most we are the most protein deficient country in the world, we also have lesser cardiovascular issues. We have less mental issues. In terms of consuming medication, we consume way less prescription than the rest of the Western world, which is primarily not plant-based. So there are all sorts of advantages also that come, but they're not talked about as much. We again, your second question: are we going to remain nutritionally deficient, protein deficient henceforth if you're going to be plant-based primarily? I think it's a very big myth that plant-based is protein-less. It's not the case. See, in nature, everything, as Seema has discussed so much about nature and getting close to your food. See, in nature, everything happens in harmony. So if you pick up a food product which is whole, unprocessed, and raw, it will have every nutrition that you're looking at, because your body doesn't only need protein.
Yeah, but if I'm only growing potatoes and eating potatoes and cucumbers, I'm not going to get the proteins, even though I may have grown it myself.
Yeah, but I'm saying that if you combine your food, you're not going to, obviously you will not consume potatoes in isolation. What if I just told you that potato is also one of the richest source of vitamin C? Bingo. We didn't know about it because it was never marketed to us. Every time you saw vitamin C, you only saw something which oranges or lemon or whatever. So citrus is what we associate with. So there are so many things that you don't even associate with, which in nature happen in balance. So potatoes are primarily grown in areas where you don't have any vegetation on the field. So all the cold countries have potatoes, and their lifestyle was built around having potatoes with meat, because that's what their nature was. Their climate is, that's what their requirement is. And if you look at Indians, and I'm not going to say just Indians, I think Chinese as well, these are civilizations which revolved primarily around agriculture, because we had the land, we had the water to do it. So hence we had more of rice and wheat. Again, I think in the beginning of the discussion, you said rice and wheat is what is controlled by the government, and because these
in the PDS system,
yeah. So because we have a very solid supply chain for both these things, they're consumed more. Of course, that's of course, that's the case. But, we've also heard people say, both of them, I think Garima also said that Pahadis eat everything. And I'm a hardcore Punjabi. And I know that rice and roti is our primary thing, but it seasonally changes. We also have missi roti. So when it's winters and palak is in season, you have everything. So I think you can never be nutritionally or protein deficient. You have to know your food in and out, from where it's grown, coming onto your plate, how you're cooking it. Also, that's also important. How you're cooking it and how you're balancing it. So we can't really isolate. It's such a complex thing. You can't really isolate it. And but at the same time, when I say isolated, even if you're isolating it in a factory and selling it off as, oh, this is vitamin C, this is your protein, I think that we cannot find balance, because the body needs protein, carbohydrate, and fat. But that's just the macronutrients. And there's a bunch of micronutrients that come. So when we're talking about food and calories and protein is what we discussed. But what we need to discuss is nutritional density of food. And if we just shift our focus from calories and protein, which are like the benchmarks these days, or carbohydrates, again, a very big scare around them. If we shift our focus from just defining food as protein, carbohydrate, and fat and calories, and make it into nutritional density. So if I look at a food item and I don't look at calories and I only focus on what is the nutritional density, I am sure you will be making the right choices, because we had the right choices in our system, in our ecosystem. They have been sent abroad, repackaged, and gotten back to us. Classic examples is New York. You can go to Starbucks and buy turmeric latte. It's not their culture. We bought it. We sent it out, and now it's come back to us.
Yes.
I remember, again, my dadi was Pahadi, and she would always make alsi ke laddu in winters. And I mean, for the longest time, I didn't realize that, when I grew up, I was consuming flax seeds, and it's the best in thing. And, that's like superfood, and we're talking about it, we're writing articles.
Make flaxseed crackers now.
Yeah, I've had those, yeah. And that's alsi. And
so, what you're saying is that we shouldn't focus on, the label saying this much protein and this much carb. You should look at the nutritional density. Now, Garima, I also want to come to you, because, you spoke about, good food, but good food is one that is absorbed well in your body. For that, you need a basic amount of metabolism. So you need some amount of exercise to come into your life as well. But there are believers of Ayurveda who feel that animal foods are not digested well in our bodies. I have seen so many WhatsApp forwards that if you eat chicken, it just stays in your gut for 5 days and it rots there, and all these things we hear about. So I want to understand from you. You're a yoga expert. Would you then say don't have animal fats? If that is true, they are not absorbed well in the body. All animal products, even milk and ghee for that sake. Because there is one set of nutritionists who say ghee is very good in omega-3s and it's good for us. We've had it through the years. We should continue with it. Some people are saying animal products are not good because, it doesn't agree with our bodies, doesn't get absorbed very well in our bodies. So where do you stand here?
Yes, in yoga practice, it is like a natural progression to this kind of a ahimsa, non-violence that comes automatically, that you get this strong repulsion and aversion towards animal products, primarily the meat. So, somebody's flesh in your plate to satiate your palate is not considered very good in yoga practice. And in terms of Ayurveda, yes, definitely they hugely believers of sattvic diet, which really helps to balance out all your triyodosha, which is your vata, pitta, kapha, which is only and only possible, they say, if you have a plant-based diet. or it's an amalgam of all the Indian herbs, millets, and also the cooking practices that come as a major role play in Ayurvedic practices. So they definitely believe in only and only plant-based diet. And also as a yogi, I know that I have been a non-vegetarian before, and I have seen the transition from that phase where I used to believe that yes, fats are definitely essential, ghee is essential. I used to feel that oh no, I need animal fat to replenish the protein quotient in my body, and as Nidhi was pointing out that there is this mindset which is there that this only and only in isolation can suffice for that part, which is not true, because when I moved from being a non-vegetarian to being a vegetarian, I realized the changes in my body. I could feel that I am much more healthier, and my practice is even better. My practice, which used to last 1 hour or something, is now 2 hours 45 minutes. So there is definitely good energy level. My skin is better, my hair is better. Touch wood, I feel definitely I have a robust immune system because I don't really fall sick very often. So these are the lifestyle changes that I've noticed in my own personal experience and capacity from being a non-vegetarian to a vegetarian. So these are all positive and very formidable changes. And I don't see any of this to be true that you have to be a non-vegetarian to be able to suffice for all the nutrients in your body.
All right, but then why are we protein deficient? We are largely plant eaters.
So Anita, I think sorry, did you ask me that question?
Yeah, I was asking Garima. You can also come in, but Garima, you've said that you've seen a great change in your body, but what to do about the protein thing? Because on an average, engines are shorter. At older age, when when your muscles become weaker and weaker, not having protein is going to come. Not having enough protein.
So how do we say that we're not having enough protein? I think vegetarian, there are so many sources of vegetarian diet, which are full sources. It is comprising of micronutrients. It is comprising of vitamins, minerals. As Seema was pointing out initially, eat local. My ethos is completely like local food, locally grown food, and seasonal fruit is something that is, your superfood. So superfood, when I say superfood, it definitely has protein in it. It could be your ragi, jowar, bajra. There are so many things. There are nuts, there are watermelon seeds, there are sunflower seeds, there are almonds. There's so many things that, mixed together in the right proportions definitely can add to your protein intake every day. So it's not devoid of protein if you're just a vegetarian or a vegan.
Seema, you wanted to say something?
Yeah, Anisha, I think, as you said that a lot of people in their older age are losing muscle mass and there is protein deficiency. That's simply because, a lot of women in India especially are not paying attention to what they are eating. And, they are trying to feed everybody else in the family, and they are the last priority for themselves. And I think for them, it's really important that, the message of nutrition and knowing that your rajmas and your cholas and your chana and all these things are really besan, these are all really protein rich things. And it's a good idea to plan your weekly menu. It's really important. I mean, just because there are so many options, but if you are not going to pay attention to what is being served every day, even if you're eating local and seasonal, but you may not ever make dals, you may never make certain things. So it's really important to follow a certain system where you know that, okay, I've included a good carbohydrate today, I've gotten a good green, I've gotten a good protein source, and that is now a complete meal for me and my family, you know.
Okay, so meal planning is also important.
But I think one portion, one thing everyone's kind of missing out on is even though we know what sources of protein are good for us, I think portion size is going to be a huge thing here. Just to give you a perspective, if you want to, a human body, an average human would need about 1,000 mg of calcium every day. Now, if I have to source it from milk, I would need about 1.5 liter of milk a day per person. Imagine how much you would need to consume. And if I consume about one big bowl of rajma, it's one portion size of even a small katori of rajma is about 350 mg. So that means if 3 bowls of any pulses, lentils, or whole legumes I'm consuming in a day, I don't need a drop of milk to consume as much calcium as I want. And that goes with protein as well. Typically, you would see Indians eating, and there's this pile of rice, and there's this dal. And that kind of explains it. Even if you have the best source of protein in front of you, you're not consuming it enough. One has to understand that it's not plant-based is bad versus animal-based. Animal-based protein is very compressed. And when I think I've turned so many people vegan over years, and what I generally do also is when I'm transitioning a person from a animal-based diet to a plant-based diet, I always tell them, give yourself 2 weeks, because your stomach is not going to understand what's going to happen. Because when you're eating this much, I'm going to feed you this much. So much roughage comes with plant-based protein. So one has to understand that even if you have the best source of protein in front of you, with animal, you eat it's compressed.
A little bit, yeah, very compressed.
And
that's what it is.
Plant-based, you have to eat a lot.
Yeah, but that is when people complain that eating that much rajma and chole gives them gas. And they're like, how are we going to deal with this? Not just rajma and chola. Should you be eating cabbage and gobi and beans? Again, you'll have digestive problems, because it is known that these are complex carbs, which are much tougher to break down in the body than proteins, which are so acidic that with the stomach acid, it just goes.
Yeah. It's not actually, I won't really call them difficult to digest. I think you have to make your body used to digesting them. I think I'd rather put it that way. Everyone will have an issue digesting them initially, but your body also needs that much roughage. So I think that's why plant-based is considered healthy, because it's good for your gut to have so much roughage. I think I'm just going to close it.
There's a long-term benefit of a vegan and a vegetarian diet is much more than, the animal-based.
Yeah, we'd like to thank Nidhi for joining us on this discussion. Nidhi is a little busy and has to go somewhere. Thank you so much, Nidhi, for bringing in your views on how to build up on our proteins and how to have a well-balanced, nutrient-dense diet. And we'll continue the conversation with Seema and Garima. Now, Garima, I want to come to you. There is all scientific data will tell you that plant-based proteins have all the amino acids required, and our body makes a few amino acids, but we don't make all. And if you eat only plant-based diet, then you don't get your amino acids. Is this true?
So I think if there is any kind of deficit in terms of amino acids, though this is not my core competency subject, nutrition and diet. I'm a yoga practitioner, but I've been a plant-based person for years. I definitely believe in one thing, that if there is anything that you feel is a problem area that you're not able to work on, then supplements are your go-to thing. I don't see what is the glitch in people's mind that they have this strong aversion towards supplements. Supplements are there to replenish anything, whether it is omega-3, whether it is your vitamin D intake, especially in lockdown when people are completely not getting any form of vitamin D. So supplements come in as a huge aid, as a huge immediate succor to fill in that kind of a bridge, if there is any.
Right. Seema, Nidhi was also saying that we need to focus on protein dense food. Plus, you said that, sometimes we don't pay attention to our meal planning. Now, to somebody who lives in a small town or is in a village, they are making do with what they get, and they also go to the PDH store and they buy things. Like my mates are from Assam. For them, a big pile of rice and potato curry is the best food possible. Now, that is their culture. That is what they have been eating for a long time. Maybe it's because of what was easily available to them in the villages. Now, how do you create the awareness that we need a more nutrient-rich diet, and it can be done locally? How do we create the awareness among the masses?
I think again, this is something that at a government level we need to reach out to Anganwadis and start it where the children are small, where the mothers are coming with their children, and give them information on how protein rich is peanuts. Peanuts are a very good source of protein and fats, which are very beneficial. And peanuts are also something grows in almost every part of India. It's very widely available. It's part of I'm not sure, but in Assamese cuisine it's there, but I know in a lot of our other cuisines in India, everywhere we have peanuts in some form. You crush the peanuts and you put it, or you make a peanut chutney, or you add peanuts to something, because peanuts were a nut which was not like the price of the almonds or walnuts, things like that. But it's a poor man's protein, and I love peanuts. I'm a very biased person to peanuts. And then things like chana. So I remember initially when Nourish Organic, we were developing products. My mother was in one of the ministries in Haryana, and she asked me to develop a very low cost, high protein laddu, which would be made of peanuts, chana, gur, and just simple laddus, which can be given to all the children in the Anganwadis when they come, like a pre-meal snack or a post-meal snack, so there are things like that, which I would love to work with the government to develop some really low cost, high protein items, which can be really given to, instead of just, again, in the PDS system, as you said, it's just wheat and rice, so if we can build in some very tasty til ke laddu. Sesame is again a very good source of high protein, and sunflower seeds are plentiful available in our country. Again, melon seeds are, very high in nutrients. So these are things that can be mixed together and made into, like in Nourish Organic, we have bars. So we can make into laddus for, mass consumption. And that's the way we have to educate the mother mainly. If we can reach out to the mother in the house, the woman in the house, the girl child, and just teach them about nutrition, because, a girl goes into another house or in her own house, she can create and get everybody to start imbibing those habits,
Right. Garima, Seema is suggesting that we should reach out to the, Anganwadi workers, the women of the household, to get greater awareness about nutrient-dense food. Now, what about yoga and the healthy way of living? Now, in my children's schools, I see that there is yoga, but my children and the other children see it as a form of PE, physical exercise. It is not seen as a holistic way of living, and I don't think it is even taught like that. It is okay for well-being of the health. There isn't a lot of emphasis on pranayama or meditation. So, do you think that if we have to begin with educating on the grassroots women and children about nutrient-dense diet, then we must also, teach yoga at school level in a fashion that people should make it a way of life, not just as a physical activity?
Yes, very rightly pointed out by you that, people look at it, the practice of yoga on merely a physical plane by calling it a PE or just, like it's meant for only flexible people and so many other myths around it. Whereas the real thing about yoga is that it's a work within. So a lot of work you're doing within instead of calling it as a mere workout. Anything that happens other than the internal changes that you encounter are all just a byproduct of this practice. So definitely, as I said, there are these modifications are in your diet also 100%. You become very well aware of what Seema was saying कि क्या खाते हो, कैसे खाते हो, कहाँ पे grow होता है, who is selling it, from where is it coming. All your sensory organs start to work. So your central nervous system is very aware that I'm only supposed to eat in a certain way, eat in certain timings, what are my windows to eat, and with this practice you're able to enrich yourself internally completely, that you have this kind of a camaraderie with food that you look at it and the first impression you understand that is this going to am I being justified to eat this, will I be able to even digest this food. It naturally comes. I've seen this happening with so many people. So they start with yoga practice just as a physical practice to kind of work on their immunity or increase their lung capacity, but eventually when they blend it with their dietary modifications, they are able to see more results and they're able to find themselves more emancipated and stronger.
Okay. Then Seema, Garima is pointing out how yoga completely changes the way we are. What I wanted to then discuss with you is that, in school we need to have a program. But how about the awareness about nutrition? Because that is not even part of a curriculum. And is that fraught with a little bit of, dilemma? Because traditionally we've been told about the food pyramid where carbs are the maximum, and and traditionally we have been told that banish fats because they lead to cardiovascular problems. When later on we came to know that these were motivated studies, and it's not actually fats, but too much carbs that can cause problems like diabetes and heart problems. So if you start diet counseling or instruction about nutrition at school, is that a good idea, or could that be counterproductive?
I think that's a really good idea. I think all children must know about what is a balanced diet, because I see children who are going to school, whatever age, they understand. A lot of mothers are very particular these days about not giving too much sugar to the children, because they can see the effects of having Coke and having Red Bulls and sweets. And the children are in a buzz, and they don't know how to control them then. So I think it's really important that the children also understand the effects of sugar on their body. And as if more yoga and other things are done, it's more about tuning inwards and knowing what am I eating and what is really going with my body now, and that's the way I want to be right now. Like if it's my sports period, am I being able to play very well, or am I really feeling like lethargic because I've just eaten a big burger, And so if the children learn to tune into their systems, and that will come with regular practices of yoga and mindfulness. And I think, good schools where the, little traditional methods of praying before you ate, everybody ate in a group and you offered the food to the Lord before eating it yourself. These are all things to inculcate mindfulness. And then when you eat with mindfulness, even I think you can digest stones also then,
But Garima, Seema thinks that, if kids know that sugar is bad, they're not going to want sugar. I don't know if that works, because, even as adults, we all love sugar. We all love the wrong things, right? I'm sure kids will also understand the importance of nutrition as they age and as they understand what suits them more. But, one of the reasons why in urban areas we have a protein deficiency is also because we eat all kinds of junk food. We have Coke, we have pizzas and burgers, which are not nutrient rich at all. And even though in schools, teachers repeatedly tell their kids, children that no junk food, no junk food, it is okay, allowed once a week or something like that. So, do you think, along with an awareness about what is nutrient dense, we also need an awareness to, or a campaign to reduce the consumption of these kind of products?
Yes, I totally second you on this point. Especially mothers have to be very, very aware of the fact that they all know, they all are aware that vitamins chahiye, minerals chahiye, fats chahiye, carbs chahiye, dairy, protein, sab chahiye, sources bhi pata hai. But what is really amiss, I feel, is that understanding that why are these things required, you know. You should know that for your child, this is required for their brain functioning, for developing their central nervous system, for उनके cells को grow करने के लिए, muscles को grow करने के लिए, fibers को grow करने के लिए, and इन सब चीजों को absorb करने के लिए in the body, we require these things. So, as for sugar intake and junk food intake, kids themselves are so very well aware of the repercussions, long-term repercussions that these things can really have, because thanks to the awareness that schools are creating now, my kids eat their 2 or 3 meals in the school daily. Whenever they go, I mean, not during this time.
Now,
So, so the meal chart is properly planned, where there is a proper segregation of what you eat in a day is giving you what calories, you know, what nutrient is there in this. So they read that, they go through it, and they understand. So they, you know, I know my kids are like, my elder one is almost 12, and we go out so many times, even when traveling, they never ask for aerated beverage or burger. They have never even touched in their life. So it didn't come from me. It came from their own awareness. They have their own ecosystem where they are very, very self-aware that, you know, this is not going to work for me. And yes, mothers have to be very, very aware that, you know, I think completely restricting everything is also not okay, but anything can be had in moderation. So sometimes if the kids like it and they want to go for it, it's fine, they're eventually kids. But when anything goes in extreme, that's where it is worrisome. So nothing in extreme, but everything in moderation is fine.
So Gaurav, you put a lot of you know, heavy lifting on the mothers, their awareness, how they, you know, bring it all up, the meal planning. You know, moms are driving everything. Now also, moms are hard pressed for time, and sometimes it's just easier and quicker to fix Maggie in the tiffin and let's go with Maggie, even though they know it's not you know, the best for their child. But you know, I didn't have the time. What could I do? I just had to make do with Maggie. Now, Seema, since you are with Nourish Organics, I want to understand from you, what kind of food innovation can we see that, you know, mothers who are hard pressed for time, may not be very aware also, can have ready solutions available on nutrient rich food? Like, you know, I go to a store, I have you know, cereals to buy, cornflakes to buy, such things to buy. They're loaded with sugar. They give me an easy way out, but they're loaded with sugar. Is there scope for food innovation of our own traditional Indian foods that can be, you know, processed in a fashion where the nutrient density is intact, but the you know, the usage is easier? It doesn't involve soaking overnight, cooking for 40, you know, pressure cooking for 40 minutes, and then masalas, and then the whole jing bang, you know, something that can be prepared quickly but is nutrient dense. What kind of food innovation would you like to see?
So Anisha, first of all, I must apologize that I, you know, going by our general conditioning, we are only talking about moms. I think it's the dad's equal responsibility to feed the children and show them the right way. And so going by that, I will refrain from saying mothers, I will say parents' responsibility. And I think Nourish Organic is very particular in, you know, when we are designing our products, and all our products are my recipes. So we when we are making them, we try and keep the sugar to an absolute minimum. So in our cookies or in our cereals and all, the sugar is also coming from mostly sources like
natural sugars,
dates and raisins.
Natural sugars.
So that absolutely natural. And we are also using coconut nectar. which is it's a sap that comes out of a tree in West Bengal, and it took us a lot of time to kind of develop that, but we're using that, and the GI index of that is much lower than that of
regular sugar, white sugar.
And white sugar, again, the table sugar, which we call, is highly refined with sulfur and things like that to make it white. Otherwise, the color was a dark brown, So by having these natural kind of sugars and then having it with fiber-rich foods is almost like so if you have one of Nourish Organics cookies or bars, you feel really full. And if you are left feeling full, then chances are that you will not have that sugar dip, which normally when happens something very high,
simple complex.
After 1 hour, the insulin level, when it drops, we feel a real slump of energy. So
that's because of the simple carbs, right? They just
simple carbs, because they get absorbed so quickly into the stream, and the insulin rises, and we feel suddenly a lot of energy. But after a while, that same rush comes down, So all our products are designed that in a way that pretty much the way nature intended. We've just put them together and tried not to mess with things, because we are totally a clean company. We don't add any flavors, preservatives, any kind of chemicals. So it's as pure and natural as possible. And then because the way it's packaged, it is easy. It is available to you. You can carry a box of mixed seeds into your bag. You can carry a packet of cookies in your bag, and eat it when hunger strikes, so that you're not making the gap between your meals a very large one. Because if you make the gap very big, then chances are that you'll reach out to that packet of chips which is hanging. You'll reach out and you'll just eat that without thinking, because when we are hungry, we can't think. So it's important to have the right things on hand. So, and our breakfast cereals are again made, some of our granolas and our mueslis have whole grain. They are not refined grains. So they come with their own fiber and all the nutrients in them. So when you're having them, they are complete foods. So we make it very easy for parents to eat healthy and to give their children healthy stuff. Yeah.
All right. But going ahead, what kind of food innovation are you looking forward to, Seema? What more can busy mothers look forward to?
Busy mothers in our school community have even transported their birthday parties from McDonald's or any fast food chain to locally, to give kids have this rendezvous with the locally grown food. We are actually hosting birthday parties in these farm places where they give them a tour. They actually go inside the kitchen, bake their own pizza. They know where the cheese is coming from. They know where the cherry tomato is coming from. They even have workshops on Sundays where kids can go. So there is all this which is already happening.
There's a lot of awareness going on. But Anisha, Nourish Organic, we are developing vegan protein bars.
Okay.
And, that should be out soon. And then we've also come up with 4 different types of trail mixes. Again, this is all because one of our taglines is healthy eating for urban living. So it's on the go kind of foods, which you can carry with you. So these are just very healthy, very clean, very tasty nut and seed mixes, which you have. And then we already have a flaxseed cracker. We are coming out with an oats and seeds cracker. Is my current favorite, So it's
kids can have it too. All these things.
Sorry,
kids can have it too.
Oh, kids will love it. Kids will love it. We have some of our kids who are our customers are 2 years old, 3 years old, and they love our bars. So I'm really happy that those mothers are...
Especially to ward off the evening hunger pangs and midnight hunger pangs. I think they come
What I was trying to get at was, Seema, that, these days there's so much innovation in food which has taken place in the Western countries, and it all may not be very, very good. You have frozen pizzas. You just take a pizza slice, put it in the microwave and eat it. Or you even have frozen meals. They'll have some rice, some vegetables, some sausages. You just open it, put it in the microwave and eat it. So, as not as much as snacks, but as full meal replacements. You think we can see any kind of innovation there, like ready paranthas that are nutritious, made from different kind of millets and other flours. Can we have these ready to be which will be air dried and then given with just cooked with a little oil or something? Can we look forward to these kind of food innovations as well?
Yeah, sure. I mean, I hope we'll develop some more interesting things in the months to come. And yeah, that's a suggestion well taken, and we'll work on that for sure.
Let's hope they're healthy as well, because I remember in New York you used to get those paranthas, but there were layers of ghee.
Yeah.
So they didn't turn out to be very. They couldn't finish one. It was so heavy.
Important to learn how to make your own paratha, because that way is the only way I can think that you can eat it healthy.
Yeah, but let's hope there are some solutions that come, because making parathas requires skill. A lot of skill, because most of the times you just wreck your parathas. But thank you so much, Garima and Seema, for joining us on this discussion and talking about how we should focus on nutrient-dense food and not just focus on how many carbs or fats or proteins are there. If we add variety to what we eat, if we eat locally and we eat nutrient-dense food, I'm sure all of us will be healthier. Thank you so much for joining us today.
Thank you so much.
Thank you for having us. Thank you.
Thank you, Garima.
Thank you.
Nice to meet you, Garima.
Likewise. Thank you, Seema. Bye.
Bara, 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 ho bara. 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 12 से नीचे मुझे चैन ना आवे, दिल धक धक होवे, सांस फूल जावे. 12 से ऊपर हो तो जान में जान आवे, चेहरा खिल जावे, सारा काम हो जावे, फिर सब कुछ लगे प्यारा, जीवन जैसे बहती धारा, सबका मैं बनूं सहारा, क्योंकि मैं हूँ more than 12. 12, 12, 12 हो 12. 12, 12, 12 हो 12. 12 के नीचे मेरा दिल घबरावे, बाल झड़ जावे, चेहरा पीला पड़ जावे. 12 से ऊपर तो बात बन जावे, शक्ति आ जावे, सांस दुगना हो जावे. मिल गया खुशियों का इशारा, खुद को मैंने फिर संवारा, खुल गया सेहत का पिटारा, क्योंकि मैं हूँ more than 12. 12, 12, 12, 12, 12, 12, 12, 12 हो मेरा हारा. 12, 12, 12 हो 12. Even I am more than 12, which means that the iron content in my blood is more than 12. If it's less than 12, then we are anemic. And being anemic is a hazard for every woman, for her health and for her pregnancy. Let's make India anemia free and take the first step today by taking a blood test. The iron in your blood has to be more than 12. More than 12.
Welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A, R, T, Advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. ARTIST has also laid emphasis on lending emergency care and medical aid to women during childbirth. ARTIST has closely worked with the national body FOGSI and international body FIGO. The skill transfer by ARTIST is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
The world moves on buttons and clicks. Smart lights adore our homes. Digital locks guard our information. And green tea is our healthy brewery. We forget how the tea bags emanate waste, polluting the environment. Bid adieu to your regular tea bags and leaves. Refresh your tea mood out of the zing with the new in thing. Introducing Shilpa's Green Tea Films. Smart brew. Ready-to-use green tea fast-dissolving films eliminate food-grade plastics altogether. Refresh, recharge and rejuvenate with the world's only ready-to-use green tea films today. For more info, visit www.shilpaotc.com.
Good afternoon, everyone, and welcome to the fourth day of Bharat Nutrition Week, initiated by Integrated Health and Wellbeing Council on the occasion of the World Nutrition Week. We hope that you all are having a good day and are safe at your home. I am Princey.
And I am Satvik. Bharat Nutrition Week is a mega movement packed with insight on nutrition and good food. The entire week is we talk about important issues related to hunger and malnutrition in India. We also address how we can achieve the target of a Poshan Yug Bharat with better agriculture and food ecosystem. As a part of this mega movement, we welcome you all again to India's biggest virtual quiz on nutrition, the Bharat Poshan Premier Quiz. क्योंकि खाने में है दम.
The quiz is initiated by the IHW Council and presented by World of Wellbeing.
We thank Asian Research and Training Institute for skill transfer. Special thank to Dr. Vidya Thobi, Chairperson of Food and Drugs and Medical Surgical Equipment Committee, FOXI, and MPure for her wholehearted knowledge and support for the quiz, and her entire team members who contributed to the Bharat Poshan Premier Quiz.
And last but not the least, thanks to our communication partner, Teamwork Communication. Let's play the Bharat Nutrition Week video.
We have captured some glimpses of amazing and exciting previous days of the quiz, and we would also like to show you that. Can we please have the glimpses of the previous days of the quiz?
We welcome you all to India's biggest virtual quiz on nutrition, the Bharat Poshan Premier Quiz. This is the day one, and the theme for today is
Calcium. Great. Round one. Let's begin with the first team. And the first team is Calcium Warriors. What does calcium do for your body? A. Builds strong bones. B. Protects immune system. Or C. Both.
C. The answer is A. The DC champions, here's your question. Which of the following works with calcium to build strong bones? A. Vitamin D. B. Vitamin C. C. Phosphorus. Or D. Iron.
Yes, sir. Vitamin D.
The answer to the question is
A.
Yes,
you guys are right.
Yes.
Let's start with our day two and round one. And the theme for today is vitamin C and vitamin D.
Like anemia fighters? All right. So
Great.
anemia fighters, here's the next question for you. What is the source of vitamin C?
I think that
B. Meat, C. Dairy products, and D. Fresh fruits and vegetables.
it should be D, fresh fruits and vegetables.
The answer is indeed D. You are
Absolutely correct.
All right, immunity boosters. Are you ready?
Yes.
Question for you is,
What is the function of vitamin C? Is it the formation of collagen? B. Is it neural function? C. Protein metabolism? Or D. Hormone synthesis?
I think it is A.
A. Formation of collagen.
Alright,
Okay,
so
great.
you answer right now, and the answer is indeed A. Correct.
Absolutely correct.
So this is the day 3, and the theme for today is
Anemia.
all right. So coming to round 1. The next question is for Protein Kings.
Protein Kings, are you ready for your question?
Hi.
Hello, ma'am. Hello.
Where do you check for anemia?
A.
Eyes. B. Tongue. C.
Palms and soles. Or D. All of the above.
Yeah, I'll also go with all of the above.
The answer is D. So absolutely correct.
Let's move on to the next question for
Health Crusaders.
how does anemia affect the body? A. Blood becomes thin. B. Blood doesn't deliver enough oxygen to the body. C. Tissues retain fluids. D. None of the above.
B. We'll go with B.
The answer is B. Correct.
Absolutely correct.
So, calcium warriors and anemia fighters and immunity boosters are at 110.
All right.
Right. DC champions are at 100 and
Okay.
protein kings, health crusaders are at 70.
Okay.
It was great playing with you all, and we will see you tomorrow again. I am so excited about
Really
the day 4.
excited. Is our team ready? Are the teams excited?
Participants, this is day 4.
Yes.
Tomorrow we have the
Yes,
semi-finale, which means we are eliminating 2 teams today. Tell me you are enthusiastic about
Yes.
it, guys.
Yes, ma'am. Yes, ma'am.
Okay,
Wow,
chalo.
we sound ready. It is a test of our amazing champions. You are playing so well. Keep up the spirit, guys.
Okay.
Let's test your food practices, food habits, and your knowledge of immunity today.
All right. So, like usual, let us begin by explaining the format of the quiz again, okay? So, this quiz will take place through 6 days. Each day has a theme of its own. There are 6 teams with 12 students in each team.
Right.
Here are our most awaited teams. Calcium Warriors,
Calcium Warriors, woo!
DC Champions,
DC Champions,
Anemia Fighters,
Anemia Fighters.
Immunity Boosters,
Today, Immunity Boosters is your day.
Protein Kings,
Protein Kings,
and Health Crusaders.
woo! Health Crusaders.
All right. So those are the teams. So 3 students from each team will get to play on one day. So a total of 18 students will be participating in the quiz on any particular day, such as today. And students will keep shuffling so that everyone gets to play the game.
Right.
And the teams that score the highest in the first 4 days get to go to the semi-finale on 5th September, that is tomorrow. And the top 2 teams which will compete in the grand finale, that will be on 6th September. Okay.
Now coming to the questions and scoring. There will be up to 5 rounds every day. Today, we will be playing 3 rounds. Each team will be asked 1 question per round. 10 points for the correct answer and no negative marking. The time limit for answering the question will depend on the round. Each team will be asked 3 total questions today and will be scored out of 30 at the end of the day. Our team will keep up the time, score, and monitor the quiz.
So
Satvik, why don't you tell us today what we have in store for the audience?
all right, so the audience, listen carefully. This is for you. Today we will ask the audience 1 question after every round. And 1 lucky audience member with the correct answer will get a reward.
Oh, I am so excited.
Yes.
Can I play in the audience?
No, you cannot play in the audience, and our participants are also not part of the audience. Our audience will answer the question in the comment box, and one of our team members will get to you with the reward.
Okay.
Okay.
Sad.
Are you excited?
I am very excited. I cannot wait to begin the quiz.
So what are we waiting for then? Then let's begin the Bharat Potion Premier Quiz 2020. Kyunki khane mein hai dum. All right.
So this is day 4. The theme for today is immunity.
Immunity. Okay, so what exactly is immunity? Is it male or female? Like, is it an organ like liver, kidney? And where is it? Where is it in our body? Is it here?
Well, I know one thing, that COVID-19 has changed the way we live, work, and care for our body with good hygiene practices. And the world is talking about their health and their body and immunity.
the world is nourishing it. They're nourishing their immunity and taking good care of it. It is realized that immunity is the most important part of our entire body system.
That's true.
Today, again, I have decided that I will not give an introduction to this topic because I don't want to give the participants any hints into the answers of the questions because today is a critical day, guys.
Yes, it is it's the fourth day of the quiz. It's the fourth day of the quiz.
Oh, yes.
Okay. Okay, then let us begin by the fourth day of our most anticipated Bharat Poshan Premier Quiz 2020. Should we start the quiz?
Absolutely. Let's start the quiz, Satvik.
All right, let me start the quiz. All right.
Hey, you put on the day 3 quiz,
Is this the day 3 quiz? Why is this the day 3 quiz? Okay, we don't want the day 3 quiz.
We want the day 4 quiz.
You want the day 4 quiz?
Oh, yes.
Is this the day 4 quiz?
Absolutely.
Okay, starting the day 4 quiz. I'm so sorry, I'm not, my knowledge of computers is as good as my knowledge for immunity. No.
At the end of the day, you will know immunity and hopefully you will know about computer.
I will definitely know immunity, but let's not bet on the computers. Okay.
So
All
the
right.
first question is for which team?
The first question is for Calcium Warriors. Calcium Warriors, are you ready? Unmute yourself.
Yes, sir.
Yes, sir. Yes.
Show us your faces. Show us how excited you are to go on to the semi-finale tomorrow.
Okay. All right. So the first question for Calcium Warriors is: the immune system is made up of A, tissues, B, organs, C, cells, or D, all of the above.
It's D, all of the
All of the above.
Which on your videos you can discuss among yourselves.
Sir, we are sure it's all of the above.
It's all of the above. Guys are sure. So locking D then, and so should we see the answer?
Should we see the answer, guys? Are you sure on D?
Yes, ma'am. Yes,
Alright.
sir.
The answer is D, all of the above. They are correct.
You're absolutely correct. The immune system is made up of the tissues, the organs, the cells, and other body parts.
All right. Okay, so that is 10 points to Calcium Warriors. Woo! Great start, everyone. Okay, next the question is for DC Champions. DC Champions, are you ready? Unmute yourselves.
Yes, sir.
Unmute yourselves.
Okay. DC Champions, here's the next question for you.
The purpose of the immunity system is to A, help germs invade your body, B, fight off sickness, C, make your nose run, or D, give you diarrhea.
I'll go with D. Ma'am, option B, fight off sickness. B. Ma'am, option B.
Guys, talking about D, are we finally?
Ma'am, that's B.
Okay. Satvik, let's see the answers.
And the answer to the question is B, correct. The purpose of the immune system is indeed to fight off sickness and not to make your nose run. All right.
Congratulations, guys. 10 points to you in this round.
Okay, and the next question is for anemia fighters. All right, unmute yourselves, anemia fighters. Here's your question.
ये हमारा क्वेश्चन आ गया. But which two are better drinks for a anemia fighter?
Guys, let us announce the question, please.
Yes, which two are the better drinks for the immunity? A, Coca-Cola, B, milk with turmeric, C, coffee, or D, green tea. Unmute yourselves.
I think it is milk with turmeric. Green tea.
B.
The question
B.
is
Ma'am, option B.
Which two drinks?
B and green tea.
B and D.
B and D.
B and D.
Should we log B and D? Should we see the answer for this question?
Yes, sir.
Yes.
All right.
Okay, Satvik, let's see the answer for this
And
question.
the answer is C and D.
You're absolutely
Milk with turmeric and green tea are the correct answers as said by the team. All right.
You're absolutely correct. The answer was milk with turmeric and green tea.
That is again my fault because computers.
Oh, yes.
Yes.
I'm so sorry for that.
All right. So the next question is for immunity boosters. All right.
Immunity boosters, where are you? Show us your faces.
Unmute yourselves.
Okay, so the next question for immunity boosters
is:
which food will increase immune system fast? A, almonds, B, yogurt, C, spinach, or D, Indian gooseberry, which is amla. Guys, remember what your mother's been telling you for the past 6 months.
Unmute yourselves. You can discuss among yourselves.
Option D, I guess.
Okay, guys, should we lock on option D? Do you all agree with it?
Yeah, that's true.
And are the other
Immunity boosters?
Option D.
Yes, option D.
Okay, guys.
C and D.
Let's
It should be
see the
spinach as well.
Okay.
Satvik, let's see the answer for this
And
question.
the answer is indeed D.
Amla, as our mothers keep saying, is very good for improving your immune system quickly.
All right. Good. 10 points for you too.
So the next question is for which team, Satvik?
Protein Kings, buckle up. Here's the next question for you. Which is the restorative process that plays a critical role in the proper functioning of the immune system? A. Sleep. B. Exercise. C. Food. Or D. Work.
We're talking about a restorative process, guys.
Okay.
I think sleep.
It's A. Sleep.
It's sleep because food helps us restore everything in our body. Yeah.
But food is not a process.
Yes, but food is not a process, no.
It should be sleep.
It should be A. With these sleep.
Okay, you want to lock A?
We're locking A, I guess, guys.
All right.
Okay.
Okay, locking A. And the answer is? The answer is A. Yes, it is
Absolutely
sleep.
correct. A restorative process, which is sleep, is extremely essential for all processes in our body.
Yes.
So the next question is for the health crusaders.
Are you ready? Unmute yourselves and show yourselves. Here is your next question. As part of the immune system, white blood cells fight germs. Another name for white blood cells is
Leukocytes.
C. Leukocytes, C. Glands, or D. Nodes.
Answer is B.
Leukocytes.
Okay.
I think we're locking on B.
All right, you're logging on to B
Sure
because
about
yes. Okay, so the answer is B. The leukocytes. Very good. So that
Guys,
was
you get 10 points. You get 10 points for in this round. I think all the teams are doing
yes.
really well.
So if my maths is good and my maths is good, so I think every team has scored 10 points for this round. Am I correct, Jimani?
Yes, Satvik, you are correct. Every team has
All
scored.
right.
Absolutely.
Wow,
Wow, guys.
congratulations, team. All
This
right.
is really good.
Okay.
Tell me what it's time for.
What it's time for? It's time for the question for the audience.
Oh, yes. Audience, here is the question for you.
All right. It's time for the audience to wake up and listen to the question. This is the question for the audience. Participants do not answer. Okay. And the question for the audience is,
which of the following will not help children's immune system? A. Playing video games. B. Exercising. C. Eating healthy foods. D. Regularly washing hands. Which of the following will not help children's immune system, guys?
all right. So our audience is requested to answer the question, write the correct option in the comment box, and we will get back to you. Okay, let's give them 10 seconds.
10,
9,
8,
7,
6,
5,
4,
3,
2.
1. All right. And the
Guys.
answer to the question is, I hope they've answered.
They've answered.
Okay. And the answer to the question is A, playing video games.
Playing video games will not help children's immunity system.
Yes. And
Don't we all know that?
yeah, we are.
I think let's begin the second round
Yes.
of the quiz. Start.
For the second round?
Teams, are you ready to
Yes.
play the second round? The only 3 rounds
Yes,
to play
sir.
today.
Yes. All right. Buckle up. Here's the question for Calcium Warriors.
Name the faster immune booster among the following. A. Curry leaves. B. Coriander. C. Ginger. Or D. Radish.
It's ginger. C.
Ginger.
I think
I also think it's ginger.
Okay,
I think C. Ginger.
Let's clock on
So
C.
should we
C.
All right. Logging on C. And the answer is C. Ginger.
The ginger does quicken your immunity boosting.
All right. So the next question is for DC Champions. Congratulations. This is 10 points for Calcium Warriors. And DC Champions, are you ready for your question?
Sir.
Okay. Yes.
Woo!
All right. Here's the question. Which of the following has immune boosting properties? A. Vitamin B6, C and E. B. Vitamin C only. C. Antioxidant. Or D. Flavonoids.
Sir, C.
Following has immune boosting properties.
Antioxidants. I see antioxidants.
Okay, do you want us to lock C, antioxidants?
Yes, sir.
Okay. Are you
Guys,
sure?
are you all sure? Should we lock on C?
Yes, sir.
All
Okay,
right,
let's
locking
lock
on
on
C.
C.
And the answer is A.
C and E have immune boosting properties.
Yes. All right.
That's okay, guys.
Yes, we have-
You have another round to go.
Yes.
And a
Okay.
long journey to see
And the next question is for
the immunity boosters.
the anemia fighters.
Anemia fighters.
Yes, anemia fighters, here's your question. Anemia fighters, are you ready?
Yes, sir.
Okay, here's your question. Which are the 3 vitamins best for boosting your immunity? A. Vitamin D, vitamin C, vitamin
Option
A.
C.
Guys, let's at least wait for us to announce the
Yes, but
question.
option B is vitamin B6, vitamin E, and vitamin C. Option C is vitamin C, vitamin B6, and vitamin E. And option D is vitamin B6, vitamin K, and vitamin C.
What do you think, Shubhadeep? I think it is C. No, I think it is A. B and C are the same. B and C are same. I also think
there
that.
is a technical problem in this question. I can see that
The previous question, there was, I think the answer to the previous question was pretty much the same, right?
yeah. So I think we will go for the second question.
All
The
right.
next question.
Yeah, sorry, anemia fighters. We'll
I'll ask you a separate, different question.
all right. So the
Okay?
question for anemia fighters is this round is dismissed, and the question for anemia fighters is which of the following does suppress the immune system? A. Exercise. B. Healthy diet. C. Smoking. Or D. Adequate sleep. Which of the following will suppress the immune system?
Smoking. Smoking.
All right. You want us to lock C?
Yes, sir. Yes, sir.
All right. Locking C, and the answer is smoking will
suppresses
the immune system. Yes.
Okay, so now the next question is for immunity boosters.
Now the next question is for immunity boosters. Here's your question.
Which of the following plant is not immunity boosting? A. Tulsi plant. B. Ginger. C. Tobacco plant. Or D. Black cumin. Which of the following is not immunity boosting, guys?
C. Tobacco plant.
Tobacco plant.
Okay.
Okay. Are you guys sure? Should we lock on
Yes.
C?
Yes.
All right.
Okay.
Locking on C, and the answer is indeed
Absolutely
tobacco
correct.
plant. The tobacco plant will not help in immunity boosting.
Whereas Tulsi, ginger, and black cumin does help boost your immunity.
All right. So immunity boosters know what immunity boosting is about. So that's good. That's another 10 points for you. And Protein Kings has the next question for you. Protein Kings, are you ready?
Yes, sir.
Yes, we are.
Okay, okay, guys. Let's see your next question.
Yes. Next question is
Which among the following do you think weakens the immunity of the immune system? A. Nicotine. B. Too much exercise. C. Stress. Or D. All of the above.
I'll go with D. All of the above.
All of the above.
All of the above. Because
Nicotine and too much exercise as well as stress.
All of the above. We'll go with D.
We'll go with D.
You guys are pretty sure, right?
yes, they're very confident. I think we should go with D.
Okay, great.
Yes.
Let's see, guys. Let's see the answer for this question.
The answer is D. All of the above. Yes, you are correct.
You get 10 points in this round. Nicotine, too much exercise, and stress will weaken your immunity in
Yes.
the long run.
And the last question for the round is for the round 2 is for, are you ready?
Yes.
Yes, sir.
All right, here's your question. Vaccines work by teaching your immune system to know what the real infection looks like. So A, is it false? Or B, is it true?
True. True.
Is that how vaccines work?
That's true.
I think it's true. Should we lock true?
Should we lock true, guys?
Yes.
Okay.
Yes.
Sounds good. We should lock true.
And the answer is be true. Correct.
The vaccines are introduced to your body as organisms that look like the ones that would affect you as a disease. And so the body recognizes them and later does not let you affect them.
All right. So that was the end of our round 2. You guys did really well. Can we have the scores, Himani?
So, except DC champions, all other teams have scored 10 points.
All right. Good. So that
Great,
was the
guys.
score for at the end of round 2.
So this is our last round, Satvik.
This is our last round, everyone. Buckle up.
Before that, what is it time for?
Is the audience question?
It's the audience question. Okay. Let's do the question to the audience, Satvik.
All right. Audience, here's the question for you. Participants do not answer. Audience, this is for you.
Children's immunity system is more stronger than adults. A, is it false? Or B, is it true?
Am I a child?
You're a child.
Okay.
You've always been a child.
So our audience will get 10 seconds as usual. So 10,
9,
8,
7,
6,
5,
4,
3,
2,
1.
All right, audience, I hope you had time to answer. Our participants did not answer, and the answer to the question is false.
It's false. Children's immune system is not stronger than adults. Children's immune system, in fact, is weaker than adults.
Yes, so make sure you get those proper diets and exercise in place. All right, so the next question for the last round, round 3, everyone. Buckle up.
Guys, are you ready? This is the elimination round, right? The day of elimination.
Yes,
ma'am. Okay.
Wow.
So here's the question for Calcium Warriors.
Calcium Warriors, unmute yourselves and show us your faces.
Say hi.
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 Yes, good, chalo. And the question for Calcium Warriors is, disease-fighting cells are stored all throughout the body. A, is it true? B, it's false.
I think it should be true.
True.
No, I think it should be.
Because they are made in the
for-
bone marrow. Because they are made in the bone marrow and stored throughout the body. I think so. WBCs, they flow with the blood.
Yes.
WBCs flow with the blood. So I'll go with true.
Okay,
I'll
so
go with
A, logging A then. Should we log A?
I'll also go with true.
All
Yes.
right,
Okay, guys.
logging the answer. And
Yes,
the answer
sir.
is the answer is
absolutely
A. Yes,
correct.
the disease-fighting cells, as he said, WBCs are stored throughout the body. Correct. All right. So the next question is for DC champions. DC champions, are you ready?
DC champions, ready? Fasten your seatbelt.
Say hi, DC champions.
Hi.
Yes.
Hi.
All right. And the question is,
Innate immunity is inborn immunity. A, true. B, false.
Sir, true.
I think so. It is true.
True.
okay.
I think they're pretty sure on true, guys. Should we lock on true?
Should we log
Ma'am, I
on
will go
true?
with false. Ma'am, I will go with false.
Guys, are we going with false?
Do you want to discuss?
Yes, sir. B.
Do we all agree?
Thank you.
Guys, do we all agree on false?
Oh,
Yes. Yes.
A.
Is it A or is it B?
You will have to come to a decision, guys. You can discuss, you can come to a decision, but what do you want to log? Okay, so we're going with,
False.
Guys,
okay, we'll just have to bring this to a vote. How many of the immunity boosters say it's true?
no, let them answer anonymously. Oh, sorry. Guys, are we on a conclusion at true?
We'll have to come to a conclusion soon.
I think you have 10 more seconds to answer. Otherwise, we lock on true.
Or otherwise, we'll just dismiss because not getting an answer will be.
Yes.
We'll just dismiss the question. Take the question.
Go with B because
Lock on it.
Lock on.
I guess let's just switch the question.
Okay, guys. I think you've missed your points for this question. So I think we are moving on.
All right, we're moving on. The next team is
The anemia fighters.
Anemia Fighters. So DC champions get no points for this round. And the next question is for Anemia Fighters. Anemia Fighters, here's your question.
The whole Bengal gram is completely restricted for the children. A, is it true? Or B, is it false?
What do you think, Nayan?
False.
No, I also think false. Sir, we will go with false.
Okay, guys, let's lock on false. Let's
All
see if
right,
that
we're
answer
locking
is
on
correct.
false, and the answer is B. Correct. You are
Whole
correct.
Bengal gram is not restricted for children.
All right, good work, India fighters. Next question is for
Immunity boosters.
Immunity boosters. Buckle up. Here's the question. Say hi, immunity boosters. Hello.
Hi.
Yes. Okay. Here's the question. Roots vegetables do not help in strengthening the respiratory system. A, is it true? Or B, is it false? You can discuss amongst yourselves. Immunity boosters, can we have an answer?
Guys, you need an answer, otherwise you will dismiss the strongest.
Is it false?
Yeah, false.
Okay, guys, logging on false.
False. And the answer to the question is? Logging on false?
Yes.
The answer is false, correct.
Root vegetables do not help, do help in strengthening respiratory system. Root
All right.
vegetables like
Good work. Protein Kings has the question for you. We're throwing you a question. Are you ready, Protein Kings? Say hi.
Hi, yes, we are ready.
Yes. Okay, here's your question, Protein Kings.
zinc has a strong role in the immune system and wound healing. A, is it true? Or B, is it false?
I think it's true.
It's true.
Okay,
Zinc, non-true.
Okay, Protein Kings is pretty confident. Good. Okay, so the answer to the question should be locked true?
Yes.
Yes.
Okay.
Great, guys.
And the answer is? It
True.
is true, correct.
Absolutely correct. Zinc has an important role in boosting immunity and building the system.
All right, so the last question is for Health Crusaders. Health Crusaders, are you ready? Say hi.
Yes, sir.
Yes, sir, we are ready.
This is the last question for the day. Okay, Health Crusaders, here's your question. Banana is not a good immune booster. Not.
False.
Is it true or
It's
B?
False.
It's
False.
Okay, so let's see if it's false.
They're confident.
I love bananas.
All right, so locking on false, and the answer is B, false. Correct. Health Crusaders are correct.
Banana is a
Good immune booster.
Thank
Okay.
God.
The vital source of vitamin B6.
Yeah, that's really nice. So, Humani, can we have the scores for the entire day today?
Yeah, for sure. So calcium warriors and anemia fighters, immunity boosters are at 140, DC
Okay.
champions at 110, and protein kings, health crusaders at 100.
All right, Protein Kings and Health Crusaders. Everyone has done a really good job.
But we are so sorry. We will have to say goodbye to Protein Kings and the Health Crusaders.
Health Crusaders, yes.
The Protein Kings and Health Crusaders will not go on to the semi-finale with us tomorrow. Guys, we are sorry for you, but we are really happy and glad that you were there with us for the entire journey. You were good players, very competitive, very sporty, and
very
we loved you
confident.
having with us.
Yes.
And if some more questions would be there, then it would be a chance.
Yeah. It's always the next. There's always the next time, guys.
Yes, you guys did really well. Can we have a round of applause for the Protein Kings and Health Crusaders and everyone out there?
Guys, let's clap for them, everybody.
Everyone in the team. Yes.
Woo!
Yes, everyone did really well. Congratulations to the teams who made it to the semi-finale.
The semi-finale tomorrow, guys. Be
Yes.
excited about it. Bring all your A game tomorrow. And before we close, Satvik, I think we have another question for the audience. Don't we?
Yes, question for the audience. Audience, are you ready? Here's your question.
The less the number of white blood cells, less is the immunity.
Here's for the audience. So A, is it true? Or B?
Is it false?
So audience, get your 10 seconds as usual. 10,
9,
8,
7,
6,
5,
4,
3,
2,
1.
and that goes your 10 seconds. So I hope the audience has answered by now. And the
What's
answer,
the answer?
the answer is
A, it's true. I think we're not sharing a screen properly.
okay.
But the less the number of
Yes.
white blood cells, less is the immunity.
All right. So that was the end of day 3. It was really
Day
nice.
4, Sajid.
Day 4, and it was really nice playing with everyone.
It was great, guys. The 4 teams, the rest of the 4 teams, we will see you tomorrow.
Yes, Calcium Warriors, DC Champions, Anemia Fighters, and Immunity Boosters. We will see you tomorrow. All right, signing off.
Take care.
Thank you, guys.
Bara, 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 ho bara. 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 12 से नीचे मुझे चैन ना आवे, दिल धक धक होवे, सांस फूल जावे. 12 से ऊपर हो तो जान में जान आवे, चेहरा खिल जावे, सारा काम हो जावे, फिर सब कुछ लगे प्यारा, जीवन जैसे बहती धारा, सबका मैं बनूं सहारा, क्योंकि मैं हूँ more than 12. 12, 12, 12 हो 12. 12, 12, 12 हो 12. 12 के नीचे मेरा दिल घबरावे, बाल झड़ जावे, चेहरा पीला पड़ जावे. 12 से ऊपर तो बात बन जावे, शक्ति आ जावे, सांस दुगना हो जावे. मिल गया खुशियों का इशारा, खुद को मैंने फिर संवारा, खुल गया सेहत का पिटारा, क्योंकि मैं हूँ more than 12. 12, 12, 12, 12, 12, 12, 12, 12, 12 हो मेरा हारा. 12, 12, 12 हो 12.
Even I am more than 12, which means that the iron content in my blood is more than 12. If it's less than 12, then we are anemic. And being anemic is a hazard for every woman, for her health and for her pregnancy. Let's make India anemia free and take the first step today by taking a blood test. The iron in your blood has to be more than 12.
More than 12.
Welcome to Artist for Her. Artist focuses on activities that will contribute towards the Sustainable Development Goals as outlined by the United Nations. We are a group of expert healthcare professional, leaders of professional organizations, national and international, key opinion makers, researchers and academicians, leading clinicians in practice. Artist for Her has adopted an ambitious vision 2022, which has been categorized under 5 verticals A, B, C, D, E, namely adolescence care and anemia control, building contraceptive choice, cervical cancer and vaccine, diabetes, emergency care during childbirth. Artist supports programs that are built around A, R, T, advocacy, research, training. Advocacy. To reach patients and professionals with the right healthcare messages on the relevant channels. Build advocacy to address health, social and economic challenges. Empower women and youth. Research. Research in Indian context to see what works for us in this complex and diverse country with unique socio-economic challenges. Improve access to innovative and equitable healthcare solutions. Our complex social, political and economic dynamic makes India a truly unique nation. Training. Working with steadfast dedication towards building skilled healthcare workforce and enabling pertinent policy change especially in the sector of women's healthcare. Artist has also laid emphasis on lending emergency care and medical aid to women during childbirth. Artist has closely worked with the national body FOGSI and international body FIGO. The skill transfer by Artist is brought to scale through a cost-effective methodology on digital platform. Our vision is to train 1 million healthcare providers to reach every woman and girl in our country. Please join us and visit the website at www.artistforher.com.
So, welcome you all to the 4th day of
Bharat Nutrition Week, and I hope everyone is having amazing time, good knowledge about nutrition and good food. This is our efforts to give you amazing knowledge about nutrition and what is happening in India and what all we need to stay healthy, what all we need to eat. And thank you, Princey and Satvik, for putting up a nice show, our Bharat Ocean Premier Quiz, which is catching up really good on the fourth day. And kids really had amazing knowledge about immunity today. Tomorrow we have protein, so we'll see about protein with other teams. So to start with, today we have Ruchira Hoon today, and she in our Healthy Khayega India show. She'll be taking us through a couple of new good recipes, and she's ex-journalist and very passionate about food, style and photography also. And she's living her passion right now and working with some well-known egg bar and olive bar also, bar and kitchen, right? So I will not take much of your time. I know you people are waiting, our audience are waiting. So I will hand over the things to you. So what do you have today? What exactly you're showing our audience?
So, hi and welcome everybody. I'm actually showcasing two recipes because I was told to do whatever healthy recipes that I thought could be done. I'm showcasing two really simple recipes that one is a myth buster and the other is just for something, you know, when you're craving something sweet and you don't want to make too much of an effort and still get all the good benefits of health with it. I'm doing both these two recipes and they're really simple, they're really quick, and you'll just be surprised at how few ingredients can come together to make something so spectacular. So first up, I'm going to do the energy bites, and if we can have the camera, the other camera on focus, please.
Yeah, have it.
Great. So for my energy bites, I'm actually using rolled oats, and that is key. We're using oats, which is great for you. It's slow, sustained energy. I'm using date syrup, which is again slow, sustained energy. I have some peanut butter. If you have a nut butter allergy, use sunflower seed butter. That will be just as good. And I'm using everybody's favorite, chocolate. And I'm using dark chocolate over here. And that's what's going to make it really fabulous. I also have some sabza or basil seeds. And
which seeds?
Basil seeds, sabza. Okay. If you don't have sabza, you can use flax seeds, you can use chia seeds, and I have coconut. So first thing first, I'm going to toast my coconut. If you have it pre-toasted, great. I'm going to turn this on. Just give me a second. I want to gently toast this. Now, why am I showing you this recipe? The real question is that. I'm showing you this recipe because sometimes in the morning when you wake up and you want something sweet but not like an entire meal, this is something that you can pop into your mouth. It has the goodness of nut butter, it has the goodness of chocolate, and if you're using chocolate, make sure you're using dark chocolate. That is really key. I also believe that coconut can really change the way things taste and feel. And again, this is slow, sustained release of energy. And so coconut becomes key. So what I want to do with my desiccated coconut, it's regular desiccated coconut, it's bazaar bought, I haven't even made it at home, is that I'd like to toast it. And the reason I'm toasting it is because I'd like that little nutty aroma to come through in it. And the nutty aroma is what is going to give, is the flavor bomb for you in this entire thing. So as my coconut toasts, I want it just gently toasted. I want it warm through. I want that nice coconutty smell coming through. And if somebody doesn't like coconut, omit this step. Nothing's going to happen. I'm using about half cup of coconut, desiccated dry coconut. Right. So this is good. This is already smelling wonderful. I don't need my induction anymore. And what I'm going to do is turn this back in, and I'm going to add my rolled oats. I'm going to add the coconut. Beautiful. I'm going to add the basil seeds. I also want to add just a little bit of salt to this. Just brings out the sweetness, just some salt. And then peanut butter.
This is normal salt or some rock salt? Or low sodium?
No, I'm not using low sodium salt. I'm actually using regular table salt. But if you're feeling like it, please go ahead and use sea salt. It will make all the difference too also. But as I am mixing this through, I also need the sweetener. Sorry, I should have opened this before. But let me just... I'm going to use my hands because ultimately that's what is going to give it all the flavor. That's how the Golgappas wala work also, right? All the flavor with your hands. So just some sweetness, about 2 tablespoons or up to a quarter cup should do. And once we have like something that resembles a dough, not a batter, but a dough. So it needs to be quite thick. That's why I haven't added all the peanut butter, because I'm going to see how it behaves. Oh yeah, behaving well. You see it's all coming together, sticking together. I'm going to mash this.
It must be smelling nice also.
Oh, it smells wonderful. And this is something I actually like eating a lot, especially, if you're doing pre-workout or post-workout, you need something, or you feel like your energy is low during the day. Just pop 1 or 2 of these, and really you can see how good you feel. And because it has everybody's favorite chocolate.
Oh, so it is a great snack for kids also.
Absolutely, it's a great snack too. And just mix it together. Chocolate chips is ideal. If you don't have access to chocolate chips, go ahead and use just cut up chocolate. Like you can take a bar of a dark chocolate Amul or a dark chocolate, like a bitter chocolate, and just chop it up. And that will give you all what you need. So this mixture is now ready. Now, ideally, under ideal circumstances, if we had the time, we would have definitely waited for about half an hour for this mixture to come together. But because we don't have that kind of time, I'm just going to roll it into gently.
You can give any shape.
You can even put it into like a brownie pan if you have, and then cut it into little bars or cubes, etc. Or we just make them into these little, into these rounds, into these bite-sized rounds, and yeah, we are pretty much good to go. But the more it fits, the more the tastes all come together beautifully. So remember that. You should ideally let this rest for half an hour, but because we're low on time, I am going to just quickly make 5 of these. And then when I do the next recipe, and then I'm going to eat one after this is done.
Oh, wow.
It's just that quick. It's that easy. It's that no fuss. If you're looking at putting it into your kids' tiffin boxes, this is a great snack too.
Yeah, tiffin. I think they will have, they really enjoy it.
Yeah, this has got everything they like: peanut butter, chocolate, and all hidden yumminess from chia seeds and all the other things. So this is how it will look finally.
I don't think so. They will wait for the lunchtime. I think they will finish it before.
Yeah, that's the idea. I'm going to go and wash my hands. I need 1 minute, and then I'm going to come back for the next recipe.
Let me have no person. It was so quick and healthy.
Okay, this is done.
And I'm sure everyone must have got the right ingredients, the quantity.
I just
tell you the quantities again. The quantity is about half cup of rolled oats, half cup of desiccated coconut, about 2 tablespoons of date syrup, about half a cup of peanut butter or almond butter or sunflower seed butter, anything you'd like, or half a cup of chocolate chips, and 2 tablespoons of chia seeds, and a pinch of salt. And that's it. And yeah, that is it. So as I do this, I move on to my next recipe.
This is amazing. And I hope our audience will catch up with this recipe soon and start making it.
Absolutely, I hope so too. I hope that is what is key. So so I want to actually talk about gourds. What are gourds? Gourds are truly one of the most local vegetables. So you can take your lauki, which is the bottle gourd. You can take the chachanda, which is the snake gourd. You can take tori, which is ridge gourd. You can take petha, which is ash gourd. You can just basically work with any of these gourds when you're making this salad. This is a no-cook salad. Now, 99% of the people end up cooking gourd. And especially in the north, you cook your gourd or any of this lauki, tori, tinda, vugera.
Okay.
Eating it kacha. This is a great way of eating it raw. Treat your gourd like a cucumber and see the benefits that come from it, and it's unbelievable. This salad uses very few ingredients, but key ingredients. This time around, I'm using fresh coconut. Can I have the overhead, please?
Okay.
Okay, great. So this time around, I'm using fresh coconut, which I have already ground and desiccated. I'm using some shallots or sambar onions or baby onions. And if you don't have that, use regular onions, that's fine. I've got some green chili and I've got some curry leaves and I have a little bit of coconut oil here and salt and water. Now for this salad, it's this simple. You will be like, why did I not think of this earlier? Honestly, it's that kind of a salad. So into my bowl, I'm going to add half of my coconut. Into the coconut, I add some green chili, some shallots. I'm so sorry, but I need some lemon also for this. So I'm going to just get some of that. But in the meanwhile,
this is as per the quantity, how much you want, so you can put.
Yeah. So I'll tell you the quantity also. The quantity is 1 green chili, about 4 to 5 curry leaves, which you need chopped, about 3 to 4 sambar onions or baby onions. If you're using a big onion, then single big onion is good. About 1/4 coconut, fresh coconut that has been ground, and we are going to use a little bit. We've already put the salt in, and here is what makes all the difference. You have to mix this in. You have to break down all the sweetness from the onion, the sweetness from the coconut, the sharpness from the green chili, and the curry leaves, of course, makes all, brings in what we call the flavor bomb. And then I'm going to add some lemon to this. The lemon is what will cure I'm using lauki today. So I've used like maybe 1/4 of a lauki. And the lemon is what is going to cure it. So we let this sit. This also needs to sit for at least half an hour before eating, because then all the flavors come together really beautifully. But in the meanwhile, I am just mixing this in, and I got my lemon into this.
Half a lemon.
Half a lemon is good. And we put in I'm going to add the lauki. I've used lauki, but like I said, if you feel like using any other kind of gourd, go ahead and use it. And now, how do I bring this all together? So to bring it all together, I'm adding a splash of water, and that's about a tablespoon of water, I'll say, and about half a teaspoon of coconut oil, maybe even less. Yeah, and raw coconut oil. And what you get extra virgin coconut oil, that's what we are using over here. And that's it. This salad is done. I'm going to sprinkle some fresh coconut on top, make it a little more appealing, and I'm going to add a little more curry patta to it, and you're done. That's it. Now, this is a very typical Sri Lankan gourd salad. You can make it with any kind of gourd. And like I said, it's really quick, it's really delicious, and it will change your mind about how to eat gourd. And that is what is key.
It's looking very healthy, and must be really very, smelling very, very good.
It smells great, it tastes great, and I know a lot of people are apprehensive about eating it kacha, because they're like, oh, kacha lauki hai, ya kacha chachinda hai, ya kacha pinda hai. But trust me when I say this, and I have converted so many people into eating raw lauki like this that it's unbelievable.
You can have some garlic toast also with this, little bit.
Sure, of course, absolutely, if you wish to. But what really goes well with this is any kind of an Indian prep. So if you're making dal or dal and chawal or dal and roti, then this really tastes good with it because it's got crunchiness from the onions.
Okay.
Something light and healthy and simple. So these are some great things. So these are my 2 recipes for you guys. I did the energy balls and I've done a gourd salad, and I hope you have enjoyed it and learned something new.
Definitely we enjoyed it, Ruchira. This was so amazing. It was so quick, fast. Ingredients were so simple that anybody, at home can easily make it. And I'm sure because during this lockdown and COVID situation, everyone is cooking and trying something new. And this will be really helpful for everyone to give a good break to their kids and for themselves both to make this energy bar and this quick salad. And this is kind of, looks like wholesome meal. If you add some garlic bread, or you said some other bread also. It was really great. I can see your passion in this.
I'm so glad to hear that.
And you were so quick, I can see your hands moving, so fast. So amazing, Ruchira, and we definitely will be in touch, and we will try and do some more shows with you for the audience.
Absolutely.
And audience are learning some good healthy tips. I think we're doing our bit to tell people to eat healthy. So
absolutely,
like this, healthy Khayega India.
Hopefully people will try. Thank you so much.
Thank you very much, Ruchira.
All right then, bye-bye.
So she was Ruchira with us, Ruchira Hoon, and extremely passionate about cooking. And today now is the 4th closing day, and I'll take you through a bit, what happened in the morning when we started this 4th day. Prakriti Podar took us, to very great insights on various aspects of, multiple having good nutrition in multiple diseases. She had a very good panel in the morning. We started, and we had very interesting panel discussion with Dr. Gaurav Thokral. He's Executive Vice President Healthcare at Home, and it was very informative. We had some new next-gen entrepreneurs talking about nutrition and how they can cure and find solution for many diseases, talking about right nutrition and affordable nutrition. Very informative. Good food talk show, definitely. It was amazing with a lot of new ideas about veg and non-veg. They say how we can, fulfill nutrition in that. And our Bharat Potion Premier Quiz is catching up very interestingly. We have Immunity Day today. Tomorrow we have Protein Day. And again, we'll have tomorrow. We'll repeat these. Tomorrow we have protein, and then Healthy Khayega India also we have some new shows. So tomorrow 11 o'clock we'll see you again at Bharat Potion Week, Bharat Nutrition Week, and we'll see you with some new topics. Till the time, stay safe and enjoy your day. Thank you very much. I must thank you, our supporting partners, artists, and Cure, and WW Foundation, Food, Drugs, and Medico-Surgical Equipment Committee, FOCSI, World of Wellbeing, and Council of Indian Food Trade for this special support. And special thanks to Shilpa, Medicare, Cyrus, British Biological. And thank you very much for today. See you tomorrow at 11 o'clock.